Yo, hold up. Wait a minute. Who are you? Hold up, Paul. Yeah, 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 yeah. Y'all already know who the mother F this is. It's Jawley in the building. Feel me? Live. My laptop's gonna die. It's only 11:25. Live. Let me put my head to chat up so we can see what's good with y'all. Dang, man. Shout out. Man, it's crazy. All right, so I'm imagining. Hello, hello. So, I'm not gonna lie. Um, if you guys don't know who I am Jawley. I'm just gonna hide this. I am, friends with Ron. I'm an editor for Ron. I will be going live with Ethan today. We're gonna be talking about a lot of really cool stuff. Specifically hormones, how that affects your bones, AGA, MSE. We're just gonna dive into a lot. Ethan joined my Discord, the Jawley Discord. I'm gonna just drop it in the chat real quick if y'all want to join it. But yeah, it's pretty. We talk about a lot. I met Ethan. He has a really good head on his shoulders. He's really smart. I really respect him a lot. He knows a lot about sleep, Bohr effects, hormones, and basically just a lot. But uh, you know, this is for those of you asking who this is. This is Jawley, Jawley. I'm an editor for Ron. I have my own YouTube channel, my own page, but just wanted to say what's up, y'all. And I will be going live with Ethan in about 40 minutes. So I'm just chilling with y'all right now. I wish I could put the chat on the screen, but I'm not sure if I can do that. But if you guys want to start asking questions, I can answer your questions, and we can kind of just go from there. But hello, Based. Hello, Himanshu. Hello, Sharma. Hello, Darren Goldclaw. So yeah, can I change my jaw structure past 17 without procedure? If you are a man, possibly with active mewing and proper tongue posture and swallowing, I say you can get a decent amount of change. Not significant, but who knows? It all comes down to dedication and your own body and bone density. But if you are a woman, I would say it'd be easier for you. But and so yeah, can't remember subscribing to this. Yeah, this is something different. Ron is he's working a seasonal job right now, so I will be kind of doing a chat, or he gave me permission to do a live stream with Ethan. So right now, Ethan will be joining us shortly. Uh, can mewing change? Can't remember subscribing to this. Me neither. I'm a big fan of JawHacks, so this is actually pretty surreal for me. Um, can mewing change my crooked nose? It's a good question, and I don't know the answer to it. I would say yeah. Uh-oh. Uh-oh. What happened to the chat? Chat. Do you still recommend face mask if you have a perfect occlusion even after the new Ilya Lipkin video? I personally do. I genuinely think face mask can bring the maxilla forward, and your mandible can come forward as well. I read an article that said your TM joint, your temporomandibular joint, can adjust and adapt up to about 5 millimeters forward. And I spoke with Dr. Quintero, who agreed with that statement. And he said your TM joint actually adapts fairly easily to new positions. Um, so I think if you were to get face mask, as long as you bring it forward and you have arch support to maintain the front teeth. I think you could get away with a couple millimeters forward. Um, but that's only with MSC. That's what weakens the sutures, and that's what allows the maxilla and the rest of the midface to kind of come forward. Would be those sutures being weakened from the MSC. So ideally, like with my treatment, what I wanted to do was just split the suture, have all the other sutures weak, and then protract as much as I could, without bringing myself into an overjet or a further deep bite. And I'm working alongside Zabad right now to make sure that doesn't happen. But I'm getting a new MSC in a couple weeks to make sure I have arch support before I really start tugging on my maxilla to bring that shit forward. So, yeah. Are y'all going to talk about Pizzo today? Maybe. We have a list of things we're going to talk about and kind of just get into a lot of what you guys have to say, and just kind of get, really in depth about, just face mask, different types of headgear, MSC, just, all of that. Does face mask impact your zygomatic bones as well, or is it confined to the maxilla? Since the maxilla is connected to zygomatic bones via a suture, well, two sutures, I say yes, it does. When you pull on the maxilla, and you have arch support, I genuinely think that the zygomatic bones will come forward. The zygomatic bones actually come forward slightly during MSC treatment as well. So adding face mask will only amplify that, I think. So yes, face mask will impact your zygomatic bones, not just your maxilla. Did you add your appliance to MSC yet? If so, how is it? I have not added my appliance to the MSC. March 20th, I think I might have said that. I will be going back to get the arch support wire to, just kind of get everything going on. But, bro, I recovered from my POTS disease. Now I have a flat foot on my left foot, and my right arch is so high. Uneven hips, neck pain, blocked airway because of tongue. It was not like this before. Wow, I'm very sorry to hear that, man. Dang. POTS disease. I don't know what that is. I'm very ignorant. Flat foot on my left foot, my right arch is so high. Wow, it's crazy how the body is so connected. Like I can't imagine like having to live life after you're having something like that, specifically POTS disease. Even though I don't know what it is, it sounds pretty bad. It's badass that Ron trusts you to do chats with people on here. I agree, man. I agree. I am Ron's biggest fan, bro. Like literally, man. Like I'm such a fanboy. So this is like so surreal for me, man. So I love you guys, and I love Ron. He's a really, really good person. He's a very, man, I can't even hype him up enough, bro. There's no words. So yeah, it's pretty crazy. Can you do 20 to 25 millimeters of MSC expansion if your intermolar width is 25? Wow. 20 to 25 millimeters is 2.5 MSCs. So the MSC maxes out at 10 millimeters. So you would need 2 MSCs to even get that. That's actually crazy. It really depends on your face and your harmony, because an orthodontist could look at you and say, dude, that's just not possible for you. Or you could say, or I don't know. I think that's a lot. I think it is possible, but it may cause a bit of asymmetry. There's always asymmetry to be worried about. And you can achieve a decent amount from tipping the teeth. But at the same time, to achieve true like skeletal expansion, yeah, you'd have to get at least 2 MSCs. I'm not sure, there could be more to expand more, but maxilla got based Hellenism asks, my maxilla got more wide since I started mewing a year ago. Will braces cause my MSC? Oh, excuse me. Will braces cause me any problem? And also, my face is egg shaped, if that makes sense. I'm a 15-year-old. Do you recommend I use MSC? Well, since you are 15, I recommend you mew. Oh, wait. Since I started mewing ago. I'm sorry, guys. Will braces cause me any problems? It depends if they pull any teeth, and it also depends if they, you know, use rubber bands or elastics. So, you know, it's really up to you. I would recommend not unless you have really crooked teeth, but I'm not sure how to help you with the egg-shaped thing. Mohammed says, "Do you think thumb pulling is effective for gaining forward growth as an alternative for face mask?" Um, yeah, I think there's merit to it if you're young enough. But as an alternative for face mask, I don't know, man, because if you have retractive elastics, those rubber bands are in your mouth pulling for 23 hours every day. So if you're only thumb pulling for, and I mean actively thumb pulling, active force for, let's say, an hour, 2 hours a day, which isn't even enough, I don't think you'd be coming anywhere close to what headgear would or elastics would be achieving in the amount of time. So it ultimately depends. But for forward growth, I think it is different when it comes to the alveolar bone compared to like strictly like the maxilla or the mandible. Um, so you might be able to stimulate a decent amount of alveolar growth or stimulation, but I don't think, um, I don't know if it's effective for, unless you're like very young. I'm not sure. The thumb force is 15 times that of elastics, though. That is very true. So I guess you could say, let's just think out loud here. And if I'm wrong, I'm wrong. 1 hour of thumb pulling equals 12 hours of, you said 15? Okay, 15, 1 hour of thumb pulling is 15 hours of elastics. So I mean, yes, I just think that would hurt, and you'd probably have to use some sort of like device or something in your hand to kind of pull, because I feel like after a while your thumbs would get sore. But I don't know. I did thumb pulling for like probably like a week or two, like before I had MSE, and I was kind of like diving down the rabbit hole. I was just like, oh my God, like I don't know what to do. What do I, I was just trying to get some sort of like expansion in my mouth because I felt like it was just being so constricted. But finally, I got MSc, but I think it's so sad because we're like, no one is really even studying this. So, but just from my opinion and what I think, if you are dedicated and you document each hour and you document how much force you put on what side of the maxilla and for how long, and you are serious about it, I think you can get a decent amount. I think you could, get some sort of change, but it all depends on your determination and discipline when it comes to that. Reg Burt. Ray Burt, I don't know how to say it. I'm going to get expansive Invisalign. Any advice? Expansive Invisalign. What are they, just like tipping the teeth? Um, yeah, I mean, when I had Invisalign, I it sucked at first because it's like, oh my God, I taste plastic in my mouth. Oh my God, I can't like chew gum. Oh my God, I can't just like eat whenever without having to brush my teeth. So if you are going to get Invisalign, just make sure you keep it clean as much as possible, and make sure you're not like gross with that shit, because you can it can actually increase your chances of getting cavities or in amplify tooth decay. Do you have any idea how many millimeters of expansion you can get with SFOT? I vaguely remember somebody saying maybe 2 millimeters. It's not, maybe three. It's not anything like crazy from what I remember. I could be wrong, but yeah, I think SFOT is just for aesthetics. Of course, it's just to kind of like fill your chin out or fill out whatever it is you're trying to. I think it's like the alveolar bone, but I've heard it's very painful. How many elastics per one side should be used, and which ones should be smaller or bigger? Blaze bits. Are you referring to protraction with headgear, or are you referring to retraction with like Invisalign or braces? If Invisalign and braces, when I had my Invisalign, it was one rubber band, the strongest rubber band on each side, connected from my canine to my back lower molar. Face mask. Okay, I should have assumed that. It really depends. Dr. Mew, I think John Mew mentioned something about the slower, the better. But when you're an MSC in face mask, you have a small window to protract. Sorry, I'm moving around, y'all. So I would say two max, because you don't want to cause any like tooth, like root resorption, from pulling so hard, or you don't want to like fuck your shit up. So just like be careful. You don't want to go too fast, because I made the mistake of going too fast at the beginning, putting like hella force on my teeth, but it ended up just like hurting really bad. And um, of course, I got like a little bit of expansion, but like it's still gonna be achieved even with like a medium amount, I guess you could say. Like don't overdo that shit. It'll come. Like you just have to be consistent with it. And you don't want to cause any like damage. Like that's the worst thing. Infinity boom, but isn't a small force for a longer period is better than big force? That's exactly what I just said. So yes, Hazan El Jazz. I'm very sorry if I'm pronouncing y'all's name wrong. I apologize. Also, are you doing jaw surgery? Hypothetically, you could do face mask and have a protruded maxilla, and then do only lower jaw surgery to align the mandible. I personally do not want to do any sort of jaw surgery. That is one thing I am trying to completely avoid if I can. And if not, I don't know. I truly want to explore the possibilities of non-surgical routes for reversing previous orthodontic treatment. Nose moss. I need to bleh, I I need to do a talk with JawHacks. I've worked for MSC providers, have had MSC, and the specific providers I work for have the most joint cases for SFOT, which is an airway benefiting procedure. What is a joint case? Mohammed, for how long and how often do you wear your elastics? And when, oh, when you had retractive orthodontics? I wore my elastics for 23 hours every single day for 2.5 years and some change. I was over retracted beyond measures. I think after my wisdom teeth got removed, I got put into Invisalign. My teeth were straight, and then all of a sudden, I had to go into retractive elastics, and I really did not want to. I did not want to, but I did, and I was in Invisalign treatment for about 3 years, and 2.5 years of that I was in retractive elastics for 23 hours a day for 2.5 years every single day. And that really did a number on my face and airway. And I truly regret getting braces. And it wasn't even really my choice to begin with. So, yeah. Do you know how many millimeters of expansion you can get laterally in the mandible with SFOT? That is a good question. Wow, 2.5 years of elastics? Yeah, that shit was crazy. Jawley, how much did Dr. Zabad take for your how much did Dr. Zabad take for your entire treatment? Over 10K. I think I overpaid, but I'm not complaining because Zabad has a lot of experience, so I'm not tripping. But yeah. Do you have any photos we could refer to? I do not. There is a live. Anyways, I am producing content soon. Space Time Tsunami is my YouTube and Reddit user. Okay, awesome. Ooh, I really want to do something. I want to go on Reddit. Okay, and I want to go into the orthodontic Reddit, and there's a post that somebody made. Orthodontics. I gotta share my screen. There's a post somebody made about like, oh, can this affect my face, or is this affect this? And everyone was like, no, it can't. But kept kept. So let me share my screen. How do I do that? 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 Shift S. Okay, can y'all see? I think y'all can see, right? Yeah, y'all can see. Y'all can see. Okay, so why did my why did my orthodontist tell me my airway or face can't be changed from class 2 elastics? Because it can't. Huh? Oh, evidence. Oh, evidence. Oh, evidence. And because your orthodontist trusts systematic reviews and analysis more than charlatans. Charlatans? The fuck? You know what? I don't like you. I don't, oh, nope. We don't want to do that. Evidence. Yes, a single study from the world-renowned Journal of Armed Forces India really changed my mind. Seems legit. You know what, Wabi Kanobi? What? I hope you trip down some stairs. That's how I feel about you. So, is the threat not morally something to question instead of downplaying it until more research comes out? Use your brain to question the physics and mechanics of it. Don't be a puppet. LOL. Orthodontists are the same people who think crooked teeth are strictly genetic. Boom! That boy got, oh my god. That boy got, oh my god. Okay, wait. I don't know if it's still sharing the screen. I wish I could go back. Hold on. Shift S, right? Okay. Let me read y'all's. What do you think? I developed an open bite after braces. I had an impacted canine. That's why I needed braces. I still have all my wisdom teeth. Could also be an open bite. Wait, I'm sorry. I need to read this again. What do you think? I opened impacted canine. See, that's I still have all my wisdom teeth. Could open bite also because I think I snagged it. Maybe. But since your canine is impacted, or was, I'm not sure if you got it removed. I'm not really understanding the question. I'm a little bit tired. You know what we should do? You know what we should do? You know what we should do, guys? You know what we're gonna do? Hold up. I'm gonna tell y'all exactly what we're gonna do. We're gonna go on Chat GPT. Yeah. All right, hold on. Chat OpenAI. Shift S. Oh yeah. Okay, so there's actually a really interesting conversation I had with ChatGPT the other day about why why certain treatments for Invisalign, or actually why retractive elastics isn't really being studied throughout orthodontics. And they're like, oh, well, to prove the airway has anything to do with, retractive elastics, you have to do this, or, there needs to be more research. And I was just like, well, isn't it like, like negligent that no research is being done? You know what I'm saying? Like, that is like, that's wrong. Like, I don't understand like why that's, not a thing. But 1 second. Okay. So let me start asking it. I got my receipts right here. So I can kind of pull this out. So let's just start with a random question. Can retractive elastics cause airway problems? There's some evidence to suggest that retractive elastics, which are sometimes used in orthodontic treatment to move the teeth and jaws into the correct position, may cause airway problems in some patients. Retractive elastics work by pulling the upper and lower jaws into a more aligned position, yada, yada, yada. Ooh, this can sometimes, in a result, narrow the airway, particularly in patients who have already... Okay, wait. Particularly patients who had already had an underlying issue with airway obstruction, such as sleep apnea. But think about this. What about a healthy teenager with no snoring, no sleep problems, and then they go and get a sleep study after this, and then they have sleep apnea? Well, you're not overweight, you're not out of shape, you didn't have any prior breathing problems to this, so why is that even a thing? That doesn't make any sense. In some cases, the use of retractive elastics may exacerbate existing airway problems. Okay, yeah, period. Making it more difficult for the patient to breathe properly during sleep. This can result in symptoms such as snoring, restless sleep, and daytime fatigue. Okay, what about UARS? All right, guys, we're going to see if Chat GPT can prove to us that retractive elastics actually causes or does anything to the airway, because, you know. Okay, I'm sifting through my little information here, guys. Okay, UARS, blah, 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 retractive elastics used in orthodontic treatment may increase the risk of UARS in some patients. Okay, what is some patients? Particularly those who already have an underlying risk factors for the condition. Those the use of elastics can cause a narrowing of the air. Whoa! So it's contradicting itself. The use of these elastics can cause a narrowing of the airway and increase in airway resistance, which can exacerbate existing UARS symptoms. So are you saying that somebody who got extractions and then retractive elastics, that it could narrow the airway? What are you talking about? Okay, patients who have been diagnosed with UARS or who are increased risk for the condition may need to avoid or modify certain types of orthodontic treatment. Interesting. Okay, so let's do this. Is the research available? Oh, shoot, I can't type. For extractions and UARS under research. Wow, I cannot type. That's crazy. Let's see. The relationship. Okay, I'm just checking the chat. I don't know how you need to expand. I'm 25. Wait, what am I looking at? Post nut clarity question? Nah, this is Chat GPT. So this is an AI. For those of you here, hold on. For those of you wondering what this is, I'm just gonna put my face, or not my face, but the other thing right here. But for those of you wondering what this is, it's an open AI. It's an AI question thing. This is basically the new Google. You ask it a question and it sifts through hundreds of thousands and millions of articles and and it just pulls all this information, and it's basically just like the new Google. Like, it's crazy. It's an AI. You ask it extremely in-depth questions, and you can even like um 1 second. You can even like counter it, counter questions to a specific paragraph or a specific sentence, and it will literally answer it for you. So here we are. We're going to look this up. The relationship between tooth extractions and UARS is an area of ongoing research and debate in the field of orthodontics and sleep medicine. Blah, 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 blah. Some studies have suggested that tooth extractions may lead to changes in the shape and size of the upper airway, which can increase the risk of airway obstruction and UARS. However, other research has failed to find a significant association between tooth extractions and UARS. Okay, how's that fair, though? I'm just bitching. Overall, relatively limited, and more studies are needed to fully understand. Okay, well... Okay, so can retractive elastics bring the maxilla backwards? So literally, you can ask this thing anything and it will tell you. So if y'all have a question, ask it a question and I'll ask it. Okay. It's important to note, however, hold on. Sometimes using orthodontic treatment to move the tooth backwards. This is because the elastics work by pulling the upper and lower jaw into a more aligned position, which can sometimes result... Oh, that was not supposed to happen. However, that was not supposed to happen. However, whether or not retractive elastics actually cause the maxilla to move backwards depends on several factors, including the patient's individual anatomy and specific treatment plan being used. Okay, so in some cases, retractive elastics may be used in combinations with other orthodontic appliances or techniques to prevent the maxilla from moving backwards. It is important to note that any changes in the position of the maxilla or other bones in the face during orthodontic treatment should be carefully monitored and experienced. Orthodontist, blah, 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 blah. Basically, you suck. Okay, so, program name. This is Chat GPT. Chat OpenAI. So, post nut clarity. I'm dead. I didn't even see that. We're gonna get rid of that. Excuse me. Oopsies. Okay. So, let's say somebody has a question. What's your question? Nah, that's cool. We're not gonna do all that. We're just gonna... Okay. Anyways, so yeah, I think that's really important to ask because a lot of the information on Google is very biased and comes as a where you have to kind of go on each website, where this website, Chat GPT, which is literally like amazing, it tells you exactly what it is, and you can question it, ask it where it got this information, question the legitimacy of the information, and like really go in depth about what you want to talk about. So it's really interesting. Yeah. Anyways, I'm gonna drop the Discord link, but first we're gonna ask it a question. So, would prevention of crooked teeth collapse orthodontics? Ask if braces for a prolonged. Oh wait. Okay, wait. All right, let's start with Zumochi. How to cure sleep apnea. Okay, let's ask it. How to cure sleep apnea. I mean, I could tell you MSE. Oh, I mean, CPAP. There's a lot of different ways to treat it. It all comes down to like what you honestly believe. So yeah, CPAP, jaw surgery is probably going to be the next one. Oral appliance, which I don't really suggest. I do not suggest oral appliances because they actually keep your tongue down, and that way you can't mew when you're sleeping. Of course, losing weight, not smoking, that'll inflame your uh, all the soft tissue in your airway. And myofunctional therapy or positional therapy, that can also be a good way to help your breathing. But the big things are going to be surgery and CPAP or oral appliances. But I don't really like these oral appliances. I guess the thing that's missing from here is, wouldn't MSE cure sleep apnea? And they're going to say, oh, well, I don't know how much it's going to affect your airway, because all of the research available right now is saying, oh, well, MSC doesn't really affect your airway that much, but it fucking does. They're just, all of these orthodontists are corrupt and they do research to basically push an agenda. It's absolutely sickening. Okay. Program name. I already did that. I'm done. Is it bad to have teeth gaps when you bite, or is it not that big of a deal at all? Teeth gaps are actually a sign of a developed jaw, and it's actually very normal to have gaps in your teeth. And I actually think people with gaps in their teeth have a more natural looking face. I don't really like when people have completely straight, no gaps teeth. It's kind of like you have no character. I don't know. That's just me. That's just me. Um, I'm asking because I'm, man, hesitant to wear elastics. I really wouldn't, bro. I really would not. Asking braces for a prolonged period of time can stunt growth. For a prolonged period of time, stunt. Okay, let's see. Oh, it's stinking. It's stinking. God damn, it's stinking. It's stinking. Dang, that's a hard question, huh? That's a hard question, huh? Yeah, look at it. Doofus, dummy. Okay, there's currently no scientific evidence to suggest that braces worn for. See how sluttish it is, because it knows, bro. I disagree. I completely disagree with this statement. I mean, I guess yes, correct. There's not enough scientific evidence, but that's because they're not doing the research. They're avoiding this type of research. It's not like they're actively doing this research. They're just like, oh, we don't want to prove that wrong. They don't want to prove this right, so they're not going to do the research. Braces work by applying gentle pressure to the teeth and jaws. Yes, we know this. This process is slow and gradual, and it is unlikely. But what does unlikely mean to have any significant impact on the overall growth and development? Okay, so what is significant? What, over a few millimeters, a few centimeters of stunted growth? How do you even measure stunted growth? In fact, orthodontic treatment can actually help. Okay, so here they are talking about expanding. Orthodontic treatment can actually help promote healthful dental and skeletal growth and development by addressing issues as malocclusion, overcrowding, and other dental skeletal abnormals that may be present. What, by extractions? Like, this is so vague. Okay, the thing I love about ChatGPT is I could question any of this and it will answer it for me. However, it is important to note that orthodontic treatment should always be carefully monitored by an experienced orthodontist to ensure that the treatment is progressing as planned. The thing with that is the standard of orthodontics is completely incorrect and completely backwards, and that there are no unintended side effects. In some cases, prolonged or improper use of orthodontic appliances may result in issues such as root resorption and gum recession, which can impact the long-term health and stability of the teeth and jaw. That is true. If you have concerns about the potential impact of orthodontic treatment in your growth and development, it is important to. Okay, so wouldn't retraction impact the face or air? Right? Question mark. So How do you get this program? It's just a website. It's called Chat GPT. I'll drop it in. Man, I wish I could put the chat on the screen, y'all. For real. Oh, I'm talking about the gap. Oh, okay. I'm sorry. I'm checking the chat right now. I'm talking about the gap. How to treat. Okay, hold on. Give me a second, guys. How do you get this program? Oh my God, I'm literally repeating myself. So how do you? No, I'm talking about the gap between your upper and lower teeth when you do a bite. Okay, so you have an open bite. Is that what it is? An ortho told me airway benefits with MSC vary, trying to say it's not likely I'll breathe better afterwards. Man's capping, nah, dead ass. That's crazy. When retraction. Okay, so that's a good question. MSC airway benefits in. See, look, bro, I literally just pulled up a research study, bro, and it's gonna tell me how much it expands the airway. Like, bro, like literally, like if an orthodontist talks to me, bro, I'm gonna say, hold it right there, pause, and I'm gonna just pull fucking Chat GPT up and just start asking them questions. Oh God. Uh oh, guys. Guys. I think we have a visitor here, guys. Guys. Here, hold up.
Can you hear me?
Yes, sir.
Sweet. How's it going?
Mr. Ethan is in the building. It's going well.
Hello. What have you been talking about?
We've just been on Chat GPT, just asking questions and just kind of BSing around. You know, just chilling. Pulling up at the ortho with Chat GPT on God. Ask about ideas to engineer a new, more efficient face mask, highlighting the problems and cons with current face masks available in the market. Okay, we have one more question to ask, and then we're gonna get into the live stream since Ethan is here. And then engineer. Okay, let me copy and paste this really quick and share the screen. Oh, I already got rid of chat. All right, I think outside of box. Oh, flipping over. Oh wait, I think this is like for this is for like actual masks, not face masks. Here, hold on. Let me stop. Orthodontic. A more efficient orthodontic face mask. Face mask available on the market. Orthodontic face masks are used to correct. Actually, I think I asked this question, a very similar question to this. Okay, better comfort is one, such as silicone, flexible materials, improved fit. I guess it's the same thing. Enhanced efficiency, absolutely. 3D printing or advanced materials to improve the speed and efficiency of the treatment process. I absolutely agree. Improved durability. Face masks can be fragile. Bitches are tough, bro. I don't know what the hell they're talking about. May need to be replaced frequently, and improved face masks could be more durable materials. Blah 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 blah. Okay. Well, I actually want to get more into this later on. Me and Ethan have a decent amount planned out. So let's bring this back in. How you doing today, Ethan? Yes, sir.
I'm doing all right.
Oh yeah.
How about you?
Doing good, man. Doing good. Just
So where should we start with? Do we want to ask any questions or to get any direction?
Yeah. If anybody has any questions about
Well, have you talked about the AGA stuff?
Nah, I haven't. Yeah, let's get into that.
Okay, maybe we can start with that. Yeah. I don't know a ton about it. Do you want to fill me in on that and fill him in?
Yeah, I can pull up the link. I think is on orthotropics. Let me look it up. So basically, some woman is suing her orthodontist because of AGA and how it affected her teeth. She's having like really bad teeth problems. Her teeth are falling out, her face elongated. Basically, what happened with the homeo block guy, everyone remembers that, Jesus, is happening with her, and she's actually suing because she was promised expansion. But AGA, I think, is like anterior growth, guided growth, uh, something like that. But it's just not. It's not going to happen. It's really not going to happen in adults. So here, let me share my screen really quick, and I can show you the S. Here we go. So somebody posted this: why MSC is superior. AGA, DNA, homeoblock, etc. are all garbage. So JawHacks posted, he said, I blew the whistle on the dangers of AGA 3 years ago. Glad the mainstream is finally catching up. Check out this must-read article from CBS. So if we wanted to go into detail in the article, we could, but right here it just says down here she used AGA, the anterior growth guidance appliance, in hopes of correcting her biting, I think, without surgery. So that's has alleged in the ongoing lawsuit that is the unproven and unregulated growth. AGA inventor Dr. Steve Galilea and his company have denied all liability. That is very sad. So let's go to the
that
comments.
photo is crazy.
Dude, look, like, wow, that's bad, man. And the fact that she's like, she looked like, relatively pretty, and this could possibly leave her like maxilla to recess or like have any bone loss like long term or permanently is like very sad. And that infuriates me a lot because if this here, let's get to the comments. Actually, no, I'm going to talk about it first. If tooth-borne appliances weren't pushed, the reason why they're being pushed right now is because the alternative to jaw surgery, there's none. I mean, hypothetically speaking, when you talk to an orthodontist and you say, "Hey, what can I do to reverse my, retractive treatment or extractions?" They're going to say jaw surgery, and we're like, "Well, sir, I have UARS. I don't have sleep apnea, and I don't want jaw surgery. Why can't I just get, MSE or something?" They're going to say, "Well, that doesn't count," or "I don't know how to do that," or "I don't provide that." And then you have to spend the next 6 months of your life trying to find an MSE provider, spending hundreds of, if not thousands of dollars trying to do consultations to find the right one, fly anywhere, like that's just ridiculous. So I think the reason why tooth-borne appliances like this are so popular is because of Mike Mew and John Mew. They're so hell-bent on trying to prove that tooth-borne appliances and expansion in children is so important that they tried to use the same philosophy for adults, and it's just not working. And since they're so popular and since mewing is so popular, I think this misinformation is being so highly like hyped up because of the popularity of the mews. And sadly, they're dying on their stand because they don't want to be wrong about mewing. They don't want to be wrong about tooth-borne appliances, but they can't put children appliances in adults. So let's check these comments out. I work for an orthodontist who does MSC, and I'm currently in treatment with one myself. We have seen many adult patients who have used tooth-borne appliances and are now in danger of losing their teeth. It's so sad that people have been fooled by these con artists who can charge double what we do, by the way. Wow, that is actually very true. Blame the current state of orthodontics. If they acknowledged skeletal expansion as a legitimate treatment for the majority of patients, there wouldn't be this huge misconception. Absolutely true. In orthodontic school, they are taught that doing phase 1, which is expansion, and then doing phase 2 when kids are teenagers is unethical because it increases the cost to families or something like this. So many kids could avoid issues as adults with easy tooth-borne expansion when their sutures are malleable. Not many orthodontists offer MSC for adults, and because it is not taught in school. Wow, and not in their wheelhouse. Besides, they only care about fitting the teeth together, and this can be accomplished with extractions. Wow. Thank you for the insight. So you're saying phase 1 couldn't prevent the need for braces or extractions, and are the side effects of extractions taught at all? Phase 1 can absolutely help prevent extractions if done when kids are growing. It won't necessarily prevent the need for braces because it is impossible to know how the teeth will erupt. But phase 1 grows the bone to allow enough room for the eruption of the adult teeth. Correct. In some instances, there are so much crowding that despite all efforts, there still won't be enough room. But being proactive can definitely prevent this. Can you explain why you think homeoblock and DNA are bad? There are some studies that show how they expand the palate. That is true. That when I was first going down the rabbit hole of, oh, homeoblock, oh, DNA, oh, AGA, I found those exact same studies that they're referencing. And this person says the OP even references that same study. The study you are referring to has a mean age of 15, and the other study is even lower. The risk of tooth loss and elongation of the face outweigh the benefits compared to skeletal expansion when treating adults. Also, skeletal appliances are the only appliance to legitimately expand the nasal cavity, not just tips the teeth like AGA, DNA, etc. You aren't only receiving airway benefits, but your cheekbones, brow bones, maxilla all expand and come forward. Skeletal expanders are way better than tooth-borne expanders. There's absolutely zero debate. Doesn't MSC only get you lateral expansion and not forward expansion? Somebody says a couple millimeters forward, not too much. That is true. It is about 1 to 3 millimeters. Dr. Ting and Lipkin both commented on this. Zabad even mentioned the same thing. So here's somebody asking, how did Vivos DNA receive FDA approval when there are no airway benefits? Well, I can tell you right now that the wax you eat on apples is FDA approved. So we don't have to get into that. Topic should have been named why mewing is superior to appliances. Tail. Anyways, I don't think you understand. Using children appliances and adults is dumb. Thinking the tongue can split the suture is dumb. The only way to expand the palate as an adult with a skeletal expander is with a skeletal expander, aka MSE. This, I don't understand why people think mewing will work. Mewing does work, but not in the way you think. Okay, well, this person says it. Mewing works, but not in the level. Here, hold on. What do you say to the stroke evidence shown by Dr. Mew in his 21 conference presentation that shows skeletal changes in elderly patients from changes in muscle tone alone due to stroke? Mewing works, but not to the level of splitting the suture. It might stimulate small amount of alveolar bone growth, but not significant enough to negate MSE. Everyone should mew. The benefits differentiate, but imagine the tongue being a support beam for the midface. That's why those patients' faces collapse. So basically, everyone's just talking about like, oh, tooth-borne sucks. What is MSC? And a lot of these people are very undereducated about all of this, such as this woman who dove into it, such as the homeoblock guy who dove into homeoblock. All of these people are under this fallacy that you can use a children tooth-borne expander to expand the roof of the mouth without the need for MSE, because guess what? They don't know what MSE is. Orthodontists don't know what MSE is. Dentists would gladly give you a tooth-borne expander because they use it for children. Orthodontists would gladly give you a tooth-borne expander because they use it in children. But they are not taught or don't even practice MSE. And that is absolutely just horrendous. Like I can't even like fathom why that's even a thing. Ethan, what do you got to say about this?
Well, I don't know. Honestly, I haven't looked into. I saw the article like randomly pop up on my feed, and then saw Ron's post with the photo. I don't know. I mean, I definitely did not have AGA or anything, but it was somewhat similar to my experiences that most of you also have with regular orthodontics, and telling you that.
Uh-oh. I think Ethan I think he disappeared, guys. I think he's playing hide and seek. So just play along, guys. Ethan, where'd you go, man? I think he lagged out. Give me a sec. Uh-oh, that's not good. Anyways, I think what he was saying was he had previous treatment and he relates to this. I'm not sure if he had AGA like he was saying, but yeah, it's definitely very sad that what happened to this woman because it's really a shame. Because Ron saw this coming. Ron really predicted, like he was saying in the post, he knew this would happen. So he's been kind of like it even happened to him. So it's just wild because I really feel bad Like I truly feel bad, but what can you do about it at the end of the day? So let me just pull up something really quick. Okay, I'm back. Cool. So I want to share my screen again. Um, this if anybody has any questions for Chat GPT, we can kind of get into that. If not, we can kind of just talk about anything else. But took El Drago says took off my own braces because they wouldn't listen to me about it. That's funny. Okay. um, it was causing me sleep apnea. They were going to make me wait a month. Got MSC after that. Well, there you go. Beautiful. Absolutely beautiful. Can you give BW from the group chat a shout out, man? Shout out BW, man. Shout out BW from the group chat, man. Yo, BW's the girl, person. Shout out BW. She's cool. Hello, says by Mike with Ariana Grande as their profile picture. I think. Um, hello guys. Anyways, I have a Discord. So if y'all want to join the Discord, I'm gonna drop the link in there really quick and y'all can join it because we be getting late in the Discord. So um y'all feel me, y'all feel me, y'all feel me, you feel me, you feel me, you feel me. So let me just get this little thing going really quick so I can, share it, my guy. Cause if not, that would suck if I couldn't. But anyways, we here. I'm just gonna copy the link really quick, quick, like. Anyways, here we go. Ignore the. I just. I don't know if that works. Is that gonna work? Yes, it will. Yes, it will. Yes, it will. Yes, it will. We Gucci. Okay, I think it is. Where'd you go, man? Where you go, man? Brother disappeared. Oh my goodness. Oh my goodness. Are people joining the Discord? Are people joining the Discord right now? Hold up. Pause. Pause. Don't do that, y'all. Don't do that. Shift S. Shift screen. How do I do this, man? Window. Yeah. Man. How do I get? I really want to Anyways, we'll just go here. Other outside of us. Switching my computer. Okay. Okay. Chat doesn't show up. Dang. Okay, hold on. Really? The chat isn't showing up? What the heck? Y'all really can't see the chat? For real? Hold up, y'all. I'm very new to this, so bear with me. I'd appreciate it if y'all would bear with me. Thank you very much. Oh, wait. Did I not drop the... Oh, I didn't drop it. Oh, my gosh, guys. I'm sorry. Here you go. Here you go. That works? Oh, my gosh. Guys, I'm a noob. I apologize. Oh, wait. I think Ethan's back, guys. Ethan is back. There we go. The man, the myth, the legend.
Hello.
What's good?
All right. Yeah. Just on my computer now because that overheating thing happens every time on StreamYard for whatever reason. Do you want to go back to what we were talking about, or are you talking about something else?
I mean, yeah, we can kind of. What was the next thing for the beginning? Do you remember?
You mean in the notes, or
Yeah.
Well, I think mainly the. I think we should talk about the face mask. I don't know if you've talked about that at all yet, but the back design. I don't know if you could show photos of that.
I don't know.
Screen share it, maybe.
Yeah, I don't have it on my. Actually, I might. I don't want to. It's not fully done yet, so I don't want to like put it out there yet. You know what I'm saying?
All right. Well, do you want to explain it a little bit?
Yeah, sure.
Um,
So I kind of been, for those of you who don't know, I've been working on a headgear um, design that is, in my opinion, the most force efficient and comfortable headgear that will be available on the market compared to, let's say, bow, let's say crane. Those are basically the only real headgears alternatives to the one that just goes on your forehead and chin. So yeah, I mean, I really think once it's done, I get the prototype done, I would be more than willing to show it and show it off. But as of right now, it's just we just have the design and what it looks like, and we've been trying to come up with ways to counteract the top force on the back. So if I could go into a bit more detail, I will. It's basically a posture corrector that is worn on the back instead of on the head, and runs up the back of your head and is minimal, sleek, goes under your shirt, and that's what is countering the force. That and there will be a wire attached to it. So, yeah, man, that's pretty much all I want to go into detail about that. I don't want to give it all out before it's done, but yeah, man, I'm gonna try to get these comments on the screen if you want to answer them. But I'm
oh
not
yeah.
sure if the chat is showing. Okay, bet. All right, straight. So if you want to ask a question from the doc we have and just kind of talk about that, and I'll try to get this on.
I don't see any.
I'll just you might have to go on YouTube and just
Oh wait, is there? Oh, back here in the comments.
yeah. Chat works. Yes, sir. I'm trying to get the chat on the screen, but if you could go into them.
I think I have it. Let's see.
I think outside of us, yeah.
So, Zumochi asked about is having polyps bad? Where are your polyps? You know, I think that depends. I mean, are they in your throat or um do you think Dr. Fauci is trying to kill us all? Maybe. um hmm. I mean, okay, how to treat overbite without braces elastics. I mean, if you know this channel at all, it's you know, as long as you don't have a severity that you need surgery, your only options, unless you're really young, as a male, you know, are going to be the MSE or the MSTO, the splitting of the sutures on the top and the bottom. Um, yeah, I wouldn't wear elastics. Uh, this person's asking. Um, I would only wear them if they're not, you know, attached to the top and pulling backwards. Like I know that Ron had them kind of going one side to the other to fix his cant, and that's definitely a good thing. But if you're just having regular braces done, that would be silly. Um, I had that as well, and would not recommend that. Let's see. You took off your own braces, El Drago. How the hell did that work? How did you take your own braces off? uh, let's see. Yeah, it seems like chat's working.
Alrighty. All right. Man, I kind of want to get into the oxygen levels. Kind of want to just dive into that, to be honest.
So where would you want to start with that?
I don't know, just one really important question really have is, let's say MSC, you get MSC, and you had your breathing pattern doesn't change. You get MSC, and then all of a sudden you have this huge influx of oxygen, and then what would that happen? Like, what would happen after?
Well, I mean, that's somewhat vague because it doesn't, is that in someone that has sleep apnea?
Well, let's just say like they
Or
didn't have.
the
I mean,
average
yeah.
person?
Let's say like UARS. Like you had orthodontic treatment, you had extractions, you had retraction, and then your breathing is kind of like fucked, right? But you're still breathing like somewhat decently, and then you get MSC, and all of a sudden you're breathing in too much oxygen, and you're not breathing out enough.
I don't really see how that would happen.
If your breathing doesn't change, that's true.
Well, because breathing, like you can't. The issue with UARS and shallow breathing and tight diaphragmatic muscles and abs really is that there's not ever a problem actually getting oxygen into the blood. It's really getting carbon dioxide out of the blood.
Should be breathing out.
Yeah. So, because in order to get the oxygen into cells, you need some level of carbon dioxide at a very specific level. And so, if you have UARS, you're obviously you're not getting enough oxygen, but it's really because you're not allowing a full deep inhale and exhale to to let the sacs inflate, fill the lungs with CO2, and then let the CO2 out. So the CO2 just builds up in the blood. But if that was mainly from your upper airway, but you were still breathing through there and you expanded it, you're not going to have I don't think there's ever a situation where you're going to have like too much oxygen,
Right. It's just too much carbon dioxide.
Yeah, but if you fix it, you're going to have way less carbon dioxide building up. That's going to hopefully come out your nose. Yeah.
Cool. What do you guys think about braces and recessive elastics, and how will they retract the maxilla? How much of the movement is in the alveolar bone versus the maxilla? That's actually a really good question. I think it really depends on if you've had extractions or not. I think if you've had extractions, the teeth will go back into through alveolarly. It'll go back into the space where the wisdom tooth was, and it'll close that gap. I think after that point, it just kind of, if depending on your age, it'll like bow the maxilla or change the shape of the maxilla, and then it'll downswing it backwards. So how much of the movement is in the alveolar bone versus the maxilla? It really depends. What do you have to say?
Yeah, I agree. Obviously it depends on the case and the person, but I think overall, your teeth are very much, even if the force is just going like, so I'll tell people that I've played saxophone most of my life, and I noticed I took a few years off after high school and had some orthodontics, I believe, finished some orthodontics that what I was doing earlier, had those done, and then they were retractive mainly, and pushing these teeth back. They have a slight overbite, but when I took my retainers out and then let my teeth revert, and I started playing saxophone again, my entire face changed in a very minor way. Obviously, it's not gonna, like, I was past puberty, and my bone structure was pretty solid, but the force going through the teeth is responsible for a lot of movement and change in bone around the eye and around the maxilla, as well as the mandible. and so even if it's not changing the total size of the mandible, it's going to change the shape slightly and the conformation of it, you know.
Right.
And if you think about it, if the elastics are pulling slightly forward and upwards this way, you know, that might have certain effects where the teeth get pulled in this direction. You have it's going to depend so much on the person. There's not one thing that's going to happen. But it's really, I agree that it's very damaging.
I agree.
And I don't see a reason to do that personally. I mean, maybe if you've already had some like extreme double jaw surgery done, or have no issues with sleep apnea, but I don't know. It's not a great method.
Do you believe in removing impacted wisdom teeth because they could put the other molars in danger? Yeah, of course. Like if your wisdom teeth are impacted, truly impacted, then yes. But if your orthodontist, or excuse me, your dentist or orthodontist or surgeon says, well, they hurt, right? And you're like, yeah, they hurt. They're growing in. Well, they could be impacted. They're gonna be impacted. That's when you have to question, okay, well, I'd rather take my chances of them growing in. And so what if they become slightly impacted? So what if they do? Then they're just going to take them out. You know, like they're not going to all of a sudden impact the other teeth unless your jaw is so narrow that like they're going to. But like if you have a decent sized jaw, if you don't really have crooked teeth and your wisdom teeth are growing in and they hurt, you tell your dentist, you tell your orthodontist, hey, my wisdom teeth are growing in. You go and see a surgeon and they're like, oh, they hurt, take them out, chuck them. Like, no. That's when you
what
have
I
to
did.
kind of, yeah, it's same. You just have, I was 16 when I got my wisdom teeth taken out, bro. Like, there's no reason a 16, 17, 18-year-old shouldn't or should be getting their wisdom teeth taken out if they're not allowing them to at least try to grow in the first place.
And you were saying, did you at all play the audio from your meeting where was it Zubad was saying that some like 70% or some number of patients they end up erupting? Or
I did not play the audio, but just take my word for it, y'all.
so can you repeat that?
Yeah. I spoke with Dr. Zabad and I asked him this question because he mentioned this to me prior. He told me that patients who get MSC, around 60 to 70% of them, their wisdom teeth actually erupt during or after expansion. And this is only in the age groups of, 14 to 24, where your wisdom teeth do erupt. So I thought that was actually very interesting. So there actually are workarounds to getting your wisdom teeth removed, and the cost. People say, "Oh, well, it costs thousands of dollars." Well, yeah, I mean, if you want to maintain your bone and alveolar bone and not, fuck up your airway, I think it's worth. I think it's worth it. So,
yeah, I mean, and how much are people paying for? Maybe it's more covered under insurance, but I mean, you're probably paying a few thousand at least for an oral surgeon to do your wisdom teeth. And you're already paying for braces.
Yeah, you might as well just get the MSC. I think like $3K for MSC, but long term, if you get a CPAP and you get cardiovascular disease in 20 years, you're going to be paying way more than that. So I currently have braces. They want to put me on elastics for a few months in order to correct my slight overbite. What should I do? Personally, don't do it. don't do it. Just get a retainer. An overbite honestly really isn't even that bad. Unless you look like Squidward trying to eat a Krabby Patty, I really wouldn't really bother trying to correct an overbite. I honestly think they are natural to an extent. But if you have a slight overjet or overbite by a few millimeters and they want to put you in retractive elastics, that's the exact same thing they told me. And it was a never-ending cycle. So I deeply regret getting that.
Mm-hmm.
There's Aiden. What's up, Aiden? But how do I correct my overbite then? You don't. You keep it. It's really not.
It depends. It really depends. You'd have to look at the person's case and their X-rays and stuff. But if it's a stable overbite and there's no, like if you have no sleep apnea, okay, it's like if you're doing this just for cosmetic purposes, then that's a different discussion. But if you have like a severe overbite and a dysfunctional jaw and pain, or you have sleep apnea or a family history of sleep apnea, you know, it's the overbite is not really the thing that you want. It's the overbite is something that is just a symptom of your jaws being underdeveloped or mismatched. And
So how could that negatively affect your life? Let's say, okay, here, let's look at it this way. You don't get retractive elastics. What would be the pros of that? You don't get your airway constricted and you don't mess up your face. Okay, you want to fix your overbite because no one can really even see it. Okay, what are the pros and cons of getting it's just like prevent, like not even doing it is just better than getting the elastics in the first place. I don't care what anybody says. I don't care what any orthodontist says. The research is there. They're ignoring it, and they don't even want to acknowledge it because there's really no other workaround to it. I think there actually is, but I personally don't think it's a good idea to even get any sort of retraction to your maxilla just to fix an overbite. Like, it's really not that big of a deal.
Even if there aren't any elastics involved, just regular, the way that, even if it's just Invisalign, like the restriction that like it's gonna change your maxilla.
Absolutely.
Just braces.
Is
get
4
out of the
years.
braces.
Absolutely. Get out of them shits. Just get a retainer. Is 4 years Mewing transformation video real? I don't know what you're talking about.
Yeah, put a link.
Okay. What do you think about root shortening of the incisors because of tipping after MSC split and movement with Invisalign? I fear damage of my incisors through MSC and Invisalign after. I've actually had this exact same thought. I think it's worth it, but I don't think the root resorption is going to be significant enough to cause any real like aesthetic changes or really any significant problems, as long as your teeth aren't completely tipped all the way out and then they tip them all the way in. You know, as long as it is slow movement. John Mew says that as long as the teeth are being tipped slowly, it decreases your chance of root resorption significantly. I don't know what that is.
Genioplasty. Genioplasty is when they cut this part of your mandible and they slide it forward and they bolt it back on. It basically, genioglossus connects the bottom of the tongue to the bone, and it's right here. And so by doing that, they partially, in some cases, will be able to slide the soft tissue of the tongue and keep it sort of anchored a little bit forwards. And it's often done in combination with other surgeries and procedures for sleep apnea. It definitely helps with lifting tissue, and I'm not sure about the hyoid bone, but you could be right about that. If it's connected to it. Yeah.
I think that's actually a good point, Aiden. But yeah, I'm not sure. I'm not entirely sure. I don't know, but like I would assume yes.
I mean, it is connected, so
I mean,
but at the very least, it's pulling the soft tissue
forward,
as well as giving you some aesthetic changes.
So it'll bring the tongue up forward and out of the airway.
Sort of, a little bit. Okay, but it's it will minor. It's not like you're not gonna like people. It's people are either doing it for purely aesthetic reasons when they're getting like double jaw surgery, or they're combining it with like upper palatal or like soft tissue surgery. So they'll combine like, genioplasty with, they'll remove your uvula or they'll remove your tonsils, and they'll do double jaw surgery. Like if you have really severe sleep apnea.
So genioplasty would, so typically it would or wouldn't, it would help with your airway.
Yeah, it's a little bit of it's a needle mover, but it's not like MSC and MSDO and double jaw surgery are way bigger movers.
Okay.
It's just a little, it's like it definitely can help a little bit. Yeah.
I don't think retractive elastics are ever appropriate, honestly, and the maxilla should never be brought back under any scenario. Okay, I agree with the maxilla should never be brought back, but I don't know how I feel about retractive elastics are like never being appropriate, because there are very severe cases where they actually need to do some sort of like retraction. But at the same time, with MSC now, I don't really see the benefit in any sort of retraction. So I do 100% agree with you. What to do with an edge-to-edge bite for a 19-year-old that already went through braces from ages 14 to 16? What do you think?
Well, edge to edge in what way? Is the question.
So assuming
if they could, if this person could put in the chat what they mean by edge to edge, but I'm assuming that you mean either your top or your bottom, like only the outer, let's say only the outside of your bottom teeth are touching the top. Is that what you mean?
I guess front. You said?
Did I say front? I meant front. Okay, here. So, edge to edge. I don't know what that means. Like what the top, front, edge to edge bun.
I'm not really understanding. Look up skull anchored tads in an alternative as an alternative to elastics.
Yeah, I saw that. Yeah, where do those skull anchored tads attach to? Like obviously they attach to the bone, but then where are they pulling forward, like on a face mask, or just inside the mouth?
I don't know.
Because I don't see why it would, if it was retracting in the same way and pulling backwards, I don't see why it would matter if it's attached to the bone. But like I know that, well, actually I don't know if Ron had the tads for his fixing his cant.
Right.
But in that case that would work. Like I think it's not like elastics are clearly not just a bad thing or a good thing, but I think mainly just pulling the back. Yeah.
Right. Yeah. Did you guys say CPAP leads to long-term? No. Can you elaborate? And I'm 9 months in, 11 months. I don't think you quite understood what I was saying. What I was saying was retractive elastics and or extractions in combination could lead to airway problems. UARS, OSA can lead to long-term cardiovascular disease and many, 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 many other illnesses, and can lead to learning disabilities, ADHD, low test levels. So CPAP actually does the opposite and it helps you. So yes, John.
Yeah. Well, I would also say that be careful with the CPAP in the long term, because it is retracting your jaw.
The pressure on your face.
Yeah, to some extent. Yeah. Anyway.
Dr. Hang says that in all overbite cases, the maxilla isn't overgrown. It is usually at normal or underdeveloped, but the mandible is more underdeveloped. That is a great point. Yeah, that is
I think that makes actually a lot of sense. Well, it's going to depend on the person, but I think you could even if you had not perfectly developed jaws, the mandible and the maxilla, but if you had, upper jaw and lower jaw that were the same size but both recessed, just depending on the movements that happen in your childhood that determine where your teeth go, like it would make a lot of sense to me that, since you want the bite in the back, your body is going to naturally try to find that bite and search for it. And as long as you don't have an underbite, it makes sense to me that the front teeth would naturally just get out of the way and create the overbite. And then if the mandible's underdeveloped, then that's of course going to happen. But I think it takes more of it takes more of an anatomical issue to create an underbite than an overbite. And they're both skeletal issues, but
yeah, I think lack of biting force or biting stimulation can actually lead to an underdeveloped mandible. Because you could be swallowing properly, mewing properly, but if you're not stimulating the mandible by chewing, I think that could also lead to an underdeveloped mandible and lead to an overjet or overbite. AVO system with lipus can reduce and help fix previous root resorption. I have absolutely no idea what that is. I'm getting AVO along with emacine face mask.
Is that like SFOT maybe?
Let me look it up really quick. Hold on. Let me go on Shift S. AEVO. What is AEVO ortho?
Low intensity pulse ultrasound.
Oh wait, I think I saw like some random old guy make a YouTube video about AVO a couple months, like probably like last summer when I was doing a lot of research. They use advanced 3D technology to create customized clear liners that gradually shift to AVO orthodontics is unique. Is it just like Invisalign?
It says something about this pulsed ultrasound.
Oh, to like help with root resorption. No, I think I
Like
know
micro.
exactly. Yeah, I think I know exactly what that guy's talking about. I saw that same video, Will, that you're referring to. Recessed maxilla is a Chad is Chad trait. What the fuck? As long as your cheekbones are good and chin and jaw. Yep. Handsome school. Bro, what the hell? I want David Goggins as an orthodontist. Yo, actually, that's a really good point because he runs so much, and if you ever watch him run when he's not talking, his mouth is completely shut, and he's only breathing through his nose. And if you look at his side profile, his face is so forward grown, it's absolutely insane. And he
Yeah.
was actually obese. He was like 300
Yeah.
pounds or some shit at one point in his life. So like that's insane. I don't care what anybody says. You can always turn your shit around with the right mindset. Women prefer your mama. Why do sometimes wisdom teeth not develop like it's a genetic or epigenetic change then? Actually read something about this that said over the past like um I'm drawing a blank. I do know that the majority of people, this is actually a phenomenon what you're referring to, sometimes wisdom teeth not growing in. I think it's like less than like 3% or 2% of the population has this occur. So I think the majority of people do have wisdom teeth. And there's also an anthropologist who discussed this and said that even in this short amount of time, evolution can't work to the point where our wisdom teeth would just like stop growing in. Or just we wouldn't have it. So genetics wise,
I'll
it's
be
just
right back. All right.
Go ahead. So yeah, there was an anthropologist who discussed this, and yeah, make masculinity great again. Make masculinity great again. I agree. I think masculinity in today's society is very shunned. I think in masculinity in the right ways itself is not toxic. I think that is a huge misconception, and I think it's actually toxic to say masculinity is toxic because that actually shuns men from being strong and acting and behaving in a manner that is appropriate for their biology. And I'm not saying to abuse their power to be a fucking asshole to women because that's disrespectful and stupid. But when it comes to being a strong man and surrounding yourself with other strong men to be determined and to stay disciplined, absolutely. Does eyelid pulling y'all are funny, bro. I don't know if that's serious. Studies have shown that birth control. Hold up, Ethan. This is his question right here. Studies have shown birth control has made females more attracted to feminine-looking men. Leon, okay. Hey, Ethan, this is yours right here. But before we get into this, before we get into that, we're pretty behind. We're gonna come right back to that question. Does Invisalign after MSC lengthen the mid face? And if yes, why does Invisalign even retract the maxilla or lengthen the face? Like Mike Mew says, because people are chewing less because of rapid teeth movement. I agree with this. After I got my wisdom teeth removed and I got put into Invisalign, my face changed significantly. My jawbone dissolved. Since I wasn't chewing and I was in Invisalign, I couldn't chew gum. I couldn't eat or clench my teeth as normally as I would. And I don't care what anybody says. I think teeth clenching to an extent is actually healthy for your face and your jaw.
We'll get into that.
Absolutely.
It's
but
very normal.
After MSC, I don't know. I think it's worth it. I decided to get braces instead of MSC after or excuse me, instead of Invisalign, braces instead of Invisalign after MSC, because I want to maintain all of the bite stimulation and bite force through braces rather than having Invisalign. So I'm getting a 3D printed Marpy with face mask. It has 6 excuse me, it has 6 screws along with piezoelectric knife. Ortho says it's a guaranteed split. Absolutely. And I'm hoping you're referring to like the new Marpy, like new MSC, where it's like all over the roof of the mouth, like some to the front, some to the middle, some to the outside. A buddy of mine, Patrick, shout out Patrick, he actually has something very similar to that, but I'm assuming you have. Piezo, absolutely, bro. Piezo will split that shit wide the fuck open. And SFOT, I'm not really knowing what you're talking about. The Lipus system. I asked ChatGPT about orthodontics and it gave a really cringe normal answers. Yeah, it did for me too. That's because it pulls from all the websites and available research, which is all driven by orthodontics, which is obviously an agenda. We're gonna get back to that question about hormones, but I just want to catch up to the chat really quick. I don't know what this guy's talking about.
You're talking about Goggins.
Oh, that's right. Yeah, he has a beautiful face. He has excellent. Correct. Both of these are correct. Bro, what you're referring to as recess just probably. Hold on, guys. Get into it. Fluoride in the tap water making us feminine and gay. Yo, if anybody's
It's not
in the
the fluoride,
Discord,
but that is true.
yo, if anybody's in the Jawley Discord, bro, oh my gosh, if you remember this conversation, bro.
Yeah. Oh my god.
Z and what's his name?
Player X or something.
Player X.
Wizardly.
Yo, that shit was hilarious.
Oh my
bro.
god.
They were going back and forth. About fluoride, bro, and oh my god, bro. And it's funny, like, I don't brush my teeth, bro.
That was funny.
Yo, shout out both of them, bro. If y'all haven't yet, please join the Discord, bro. We be getting lit, bro.
Did you put a link in the
Yeah.
Right.
Hold on. Yeah, join the Discord, yo. Would everyone look perfect if the environment was perfect? I personally think so, yes, as long as you were breastfed and you chewed with the right diet for the majority of your life and you nose breathe your entire life with proper tongue posture, proper swallowing, 100%. Prefer Dr. Hang smiles over Dr. Change. Okay, let's read this last question and then we will get back to the hormones because this man Ethan is a legend when it comes to knowing about this shit. SFOT is used to advance the lower teeth to match the advancement from the face mask, surgically facilitated orthodontic treatment. That is true. But I also think if you were retracted previously with by orthodontics and with extractions, your temporomandibular joint will adapt much further forward than what a lot of people would truly think or assume it would. So I think SFOT just masks the problem rather than allowing the TM joint to do the majority of the work. So if you do,
well, I think that it can provide a little bit of expansion, but it's really more powerful in creating a more stable bite and helping to reduce some of the root resorption of if you were to just move the teeth through the existing bone, right? You're going to have tons of bone loss and you can't do it very quickly. It takes a long time, but with SFOT, they put it in, right? And they can move your teeth through the new bone in a much shorter period of time. And so you're left with a much more similar amount of bone than what you had before and your teeth in there in a new position.
Yeah, so
yeah, it's not gonna account for if you have a millimeter of expansion forward from the face mask, or sorry, a centimeter forward. It's not gonna give you a centimeter if your bite's that off. But
I want to answer my Hain question. Okay, wait, Dr. Hain. Okay, I'm sorry, I didn't see it. My bad. Dr. Hain seems like he's the only one to reopen past extractions without MSC. How does he do it? Seems like he does tooth tipping to get open space, but how? I already had a consult with Dr. Ting. I don't know. Maybe with slow tipping, some sort of protraction, maybe some spacers in the teeth to kind of reopen that space. Maybe even face mask. But I'm not entirely sure. I don't know a whole lot about reopening gaps like that. I asked Dr. Zabad about reopening gaps after MSC to possibly put like an implant there, and he wasn't really open to the idea. He said, yes, you do get a gap, but after you kind of use your retainer, the teeth wouldn't really come back, and you wouldn't really need a upper implant because it's close to the nose, and the implant can actually go into the nose and restrict nasal flow. But I don't really know. I'm not sure if I agree with that.
Yeah. Well, I don't know about Dr. Hong, but I know that Yusefian, when he is getting patients ready to do the dame split on the bottom, that it takes, he basically just pushes the teeth like with Invisalign orthodontically outwards to create a gap. So you could probably do it a similar way. I don't know anything about Hong or Hang.
Yeah, same.
But
great question.
Probably, I mean, I know I have seen those like metal devices, the metal distractors, but yeah.
Okay. All right, guys. One more, and then we're gonna go back into Leon's question. Of course, ascend CPAP versus BiPAP, ASV. I don't know a whole lot. I know CPAP goes in your face, can recess your face, and actually inflame the tissues and your throat and airway. And yeah, that's all I pretty much know about that.
So my understanding is that the BiPAP is delivering the positive pressure only when you're breathing in, and the CPAP is just giving you positive pressure all the time. That's what I understand. I don't know. I haven't thought that much about it. I don't know what ASV is, but it's probably the same thing as BiPAP. I mean, I don't know. I'm basically just spitballing why each would be more beneficial. I'm not sure why you'd want to have. I'd have to think more about that, but it might be more beneficial to be able to to not do the CPAP and do the BiPAP, so the air would be able to leave at a regular speed instead of like having to push against the positive pressure of the CPAP that's there all the time.
It's also really difficult to even get CPAP or BiPAP as a young man, or even somebody like below the age of 30, because if you don't have like severe sleep apnea, they're not going to give you CPAP. I know I have UARS, and spoke to an ENT. I got a sleep study done, and they basically were just like, nope, we're not giving you a CPAP. Get the fuck out of here. And I was just like, bro, like for real. And then I ended up getting MSC, and now I don't even need a CPAP. So it all worked out.
Well, if anyone really wants to get one, you can easily get them online without a prescription. But like, it's just not a long-term solution for sleep apnea. But if you need it, don't wait to have a doctor approve it for you. Just go get one.
I'm gonna scroll up to the original question by Leon, and then we're gonna answer this last question. Oh wait, I think I passed it. Okay. Had retracting effects after non-extraction braces, especially in the mandible. What can I do to reverse the effects? I think why that happened was they brought the front teeth backwards, and that affected the bottom teeth by tipping them inwards and caused root resorption in the chin. And that's why your mandible is recessed, or even brought your top teeth back, and now your chin is and your mandible is back bite-wise, so that even recessed your mandible even more. What can I do to reverse the effects? When it comes to the mandible, you have very few options. You can either tip the teeth back out and get SFOT, you can get MSDO, or you can get jaw surgery.
Yeah,
that's pretty much it. Do you have anything to say, or do you want to go into the birth control?
Well, I don't know this person's case, but what I noticed so I still have an overbite, but I had an overbite when I was initially getting treated with Invisalign and the elastics, and it's weird. Like I actually noticed. So they brought my front my front two teeth and four teeth mainly in, right, and kind of up pointed the roots more upright instead of backwards, and then they obviously flared the bottom teeth outwards and created a wider arch, and that totally fucked up my bite and my jaw. However, I did notice that when I stopped using the elastics and the just all the trays and let them revert, that the the bite, the force going through all the teeth, or as many teeth as you can, right, is a very important thing to have, and that it will change like your face, the shape of your face slightly, and it's not necessarily something that you don't necessarily want to. You don't have to let it revert before you get the treatment, because it's you might want to just not have to deal with having to drag the teeth back and forth through the bone over and over, right? If you already have had that retractive orthodontics but non-extraction braces, right, and your bite is better, but your jaw feels worse, your airway's worse, I personally would keep the bite, because it does over the course of months or a year, if you just let it go, the back teeth will tip inwards and pull your maxilla backwards. Like you will feel, I've felt it in my face, it's for sure. So there's no, you can't reverse the effects unless you want to actually change the skeletal issue that was there to begin with, which I'd recommend. But
about 5 more minutes, and then we'll get into what we were planning on talking about. With these, they're asking a bunch of really important questions. Do you think acne and craniofacial dystrophy are correlated, like Mike you suggested? Absolutely. I think the lack of oxygen can disrupt your hormones, especially when you're growing, and can increase your likeliness of getting acne, or even just stunting your growth, stunting your brain development. And that has a lot of stress-induced factors, especially if you know it's happening or you don't know it's happening. You would know more about that than I would, and I think we're going to get into that when we talk about hormones. But acne specifically, would you know anything more? Or just kind of like
I don't have any thoughts about that, honestly. I could maybe.
In the neck is supposed to be is that, like a lymph node or something? I'm not really sure.
Carotid sheath. I mean, the carotid artery. I mean, I've not heard of the carotid sheath. I'm assuming that it's part of your lymph nodes and your. I have no idea. But it definitely does. Is this in reference to something, or is just randomly?
I'm not sure. It's because of the lymphatic system, dude. Furock, dude.
Oh, they're referencing the craniofacial dystrophy in connection to acne.
Oh, we're tripping.
Yeah, that makes sense. That makes sense. Like that could definitely be a mechanism for facial acne, among other, as well as a bunch of hormonal changes that happen when you have no oxygen.
Wait, hold on.
Yeah.
I'm not sure. Okay, so we're gonna get into this question. Studies have shown birth control has made females more attracted to feminine-looking men. Mr. Ethan.
Well, I don't know where to start with this.
It's
definitely yeah. I've seen those studies as well. We were talking about it a week or two ago privately. It's a very interesting topic.
I guess we could start off with how hormones affects your bones, and how estrogen and tests could help you. Like you were saying, I think that's a pretty interesting topic. We can just get into that, about if you're going MSC or doing MSE, and your estrogen levels are higher, you can get more bone change, like you were saying. And then we can kind of go into like the birth control part.
Well, let's just be careful. Well, obviously this is not medical advice or whatever, but
absolutely,
there's as someone said in the chat, like there's a million variables to this, and you certainly. So this mainly stemmed from a question that I forgot who it was in the server that asked about TRT, and this person was 19, I believe, had a test level of like 350 nanograms per deciliter, I believe. And if you don't know anything, so if you don't know anything about hormones, that number indicates that your testicles are functioning, right? It's definitely low for your age. Well, and for any age, it's low, definitely. But it's not, if it was 50, 25, 100 nanograms, you would be legitimately hypogonadal, meaning you have indications of your testicles not being functional. um that, but in that case, that guy, that if you're watching, I think we already talked about this, but if you're watching, like, your TRT would be a horrible move because you're just going to shut down your testes more. And um you need to see, if you were really hypogonadal and you had no test, you would really need to see where, if your brain is not sending the signals to your testes, the hormonal signal, or if your testes physically don't work. And so most of these people, like, they're just hypogonadal, have low tests, but their balls still work. So okay, so let's see. I guess that we, there's no, there's a group of people that are under, there's a group of teenagers that are very into experimenting with chemistry and their anatomy, and um I personally was not experimenting with that kind of stuff. However, I was definitely interested in that sort of experimentation as a teenager. But there's this process where during puberty there's a the spike of hormones, as mainly testosterone in men, and as well as HGH, human growth hormone, and those are highly responsible and correlated to puberty. And then right at the end of puberty, when you have a small peak of estrogen, that is what triggers the growth plates in your bones to close. And it's not the growth plate closure process is a slow process, that it's gradual. It's not just like you hit a certain age and your sutures are closed, and that's why that there's not like one age cutoff that you can stop, that mewing doesn't work, or that MSE won't give you a split, because everybody's different. But if someone were inclined to, there's ways to experiment with, if you're young enough, to inhibit the estrogen, so that the estrogenic signaling, so that your growth plates close at a later date. And so, I mean, this is not exactly connected to birth control. We could connect it to that, but if anyone is really curious about this, and you're young enough, because if you're not young enough, it doesn't matter if you inhibit your estrogen or mew a lot. Obviously, like, you're not gonna split the suture. But if you are young enough, and like, doctors are not gonna be on board with any of this. Like, it's not. There's some that would be, but you'd need to, like, really get it diagnosed and treated properly. But since people are just gonna buy shit online anyway, the aromatase is the enzyme that converts testosterone to estrogen in the body, estrogens. And so if you're catching it early, the puberty, and if you're catching it, if you start the treatment early enough, it is extremely successful at keeping the growth plates open, especially for people with idiopathic, like short stature, and people who have a growth hormone deficiency, or don't have a growth hormone deficiency but are still really short for some reason. They'll have a combined treatment with AIs, aromatase inhibitors, to inhibit the estrogen formation, and then growth hormone on top of that. And so that's something that I think that in this community could be really interesting. I'm certainly not young enough to experiment with it, but maybe I would if I was young enough. I'm not sure.
Yeah, I think like the estrogen levels, like just experimenting with your hormones, it's really a minefield, unless it's, of course, it would have to be like very well controlled. But it's just like
you gotta like really
if you
look
were
into
that
it.
age, like I don't know, I think it's just like specifically like teenagers, like 16, 17, 18, 19, you know, like I don't know. I think because at that point, like
Well,
before
even
that,
earlier than that, if you could, but
I don't know. I feel like wouldn't that be like fucking you up, you know, like development, like your development, like hormone wise, like brain development, you know, like wouldn't that like affect you if you're a man, increasing, you know, like your estrogen levels? I mean, it happens naturally, but like still like unnaturally, I guess you could say.
What are you asking? Because
I don't know.
what I'm proposing is inhibiting estrogen formation.
Okay, that's right. That's
not
right. I had it
raising
backwards. I had it backwards. My bad.
Yeah.
I don't know. I don't
It's
know.
still no. It's still you're still right that you're involving a lot of systems that nobody fully understands. But again, like I'm trying to talk to people that are, 19 and are just randomly going to get on tests without knowing anything about like how hormones work.
Right.
And like if you're going to do that, an AI is a way better choice, just because for many reasons, but it's basically like, even if you're not in puberty, for fertility treatment, it's a very common treatment, a drug that's involved in treatment, that basically there's this feedback. Some of you guys probably know about this, but there's a feedback mechanism in your brain where you have estrogen receptors in your hypothalamus and in your pituitary and your hypothalamus. But when you have estrogenic signaling in that part of your brain, it inhibits the release of luteinizing hormone LH and FSH, which are just the hormones that your brain sends to your testes or your ovaries to send out to create new hormones and create new sperm, release eggs, etc. So even if you aren't a teenager and you're older, and your test is low, like that kid is 19, the first thing you should not even start. The first thing you should really do, if you're, aside from any lifestyle factors and removing things from your plastics, which is very important, you definitely are better off starting with an AI, because you're gonna have higher testosterone, right? And you're gonna inhibit the feedback signal to your brain, so that your brain will send more LH and FSH to your testes, right? So over time, that in a lot of cases, that's very effective for fertility, and increasing testosterone. So if you are worried about that in terms of masculinization and not being masculine enough because of your test level, you don't want to just take testosterone, and you don't necessarily want to take HCG, which is mimics the hormone from your brain, because that can shut off your brain as well, the brain signal to the testes. But I think the AI is so that definitely can help a little bit. However, just lifestyle wise, get all of your filtered water. People were talking about the fluoride
Yeah.
before. I'm not I'm not a fan of fluoride, but I think it's like one of it's not like the biggest issue in our water personally, that I think, like in terms of all the things that are in our water system. They like our water facilities do not filter out steroid hormones. They don't filter out birth control. Um, they like there's so many different compounds that they just
Wow.
can't filter out at all.
Right.
And they can filter them out, but they know they're in there, and they choose to not filter them out. So
Damn.
you absolutely need to get. I got a tabletop. Doesn't have to be tabletop, but you need to get um, not just any water filter, but really I like reverse osmosis combined. Um, I like full filters that have multiple filters in them,
Yeah,
basically.
absolutely.
Uh,
Because
you
like
definitely, yeah, reverse
yeah,
osmosis.
there was just a thing I just saw about someone getting like some sort of parasite just from washing their face in Florida, like just with tap water, you know?
Yikes.
Like that's insane. Or actually I think he was using like a neti pot.
Oh yeah.
Like a
Yikes.
dumbass. He used like fucking tap water from Florida, the fuck, and got a fucking amoeba or some bullshit. But
Yikes.
somebody asked a question about uh where'd it go? Where'd it go? They're like, oh well, how is it that people in the East or something? I'm fucking hold on, tripping. Did they delete the message? Oh, okay, here it is. Um,
Yes.
I personally think that balding and craniofacial dystrophy are correlated. What is your opinion about that? Absolutely. It happened to me.
Dude.
Not severely, but it still affected my hairline and amplified like my hair loss within a year. And that's actually
Dude,
insane.
it's such a rabbit hole. I don't know where to start with it, but keep going. I don't know if try to find this.
Go ahead, man. I mean, yeah, there's somebody else said I don't believe so. LeBron is balding where he is a Chad. I think just and then of course, some people are more sensitive to DHT. That's right? That's correct. Some people are more sensitive to DHT, which is a byproduct of testosterone, right?
Yeah. People
Um,
have different sensitivities.
so so for LeBron, for example, it also has to do with maybe genetic, maybe environmental, maybe more stress. Maybe living in America is just extremely fucking stressful, and that's why more people are bald here. I don't know. I think it's definitely, um, you know, genetic as well. But at the same time, somebody said, but even Weston Price noted that the absence of balding, there it is, in traditional cultures and the presence of it in modern maldeveloped people. Like again, it might have to do with diet, it might have to do with stress, it might have to do with higher test levels. I'm not entirely sure.
Yeah, people mentioned that What I've Learned video. I don't know if you saw that, but someone mentioned it in here. But there's I can't find the study right now. Yeah, there it is. Yeah, that's a great video. Check that channel out. Check that video out. It's not fully yeah, anyway, it's great. But there's it's always if you think about all the most bald people, right, that are actually they're not like just have their head shaved. They're actually bald, and they lost the hair. The head shape is really changing. Like the entire skull is changing at the same time, right? So
Because of the test, you're saying?
no, because of the muscular force going through the skull,
Oh,
based on
from
lifestyle
chewing.
factors and from chewing. Yeah, and
Okay.
chewing. So like, there's always going to be exceptions, but generally, there's a muscle that connects to your forehead that runs all the way back down your head, and then there's two on the side, right?
Mm-hmm.
I mean, there's a bunch on the side, but those are the three main ones. And
Bro, you have like such a good shaped head, bro.
thanks.
What the fuck, bro? That's crazy. You got like a motherfucking Chad head, bro. God damn.
But so the craniofacial dystrophy definitely is connected, partially just because of the lack of oxygen. in the blood. But if it's correlated with sleep apnea, but if you don't have sleep apnea and you just have an overbite, there's significant, like, what I've felt a lot is when I have the, like, when you're biting and your back teeth sort of pull the back lower teeth, pull the up back teeth. Yeah, they pull the upper back molars backwards and retract your maxilla, right?
Right.
Especially after MSE. But I haven't had MSE. But when I got my retainers out and I stopped using that, the same sort of tension that you feel run through your face, like, that is affecting, like, the tension in your
All of it.
forehead here.
Absolutely.
Plus, if you combine that with, like, forward head posture
Yep.
and you're literally just tightening the muscle that runs from here to here. You're just pulling on it, right? If you have forward head posture, you're tightening the back of your neck, and then, like, if you might be scrunched like this. Plus this bone is literally being forced backwards like this. You're putting up tremendous amount of stress here and creating thinner skin. So that's like just one physical way it could happen. But if plenty, it's pretty well documented that, and Yousefian mentioned this in his interview, but it's well documented that with sleep apnea, it's very common that you'll have co-occurring prostate cancer, or at least benign prostatic hyperplasia, which is just like growth and hardening of the prostate, not necessarily cancer. But in a lot of tissues, DHT is partially responsible for the fibrosis of tissues and hardening of tissues. And part of that is happening in your hair when you bald, because you're losing some blood flow due to jaw recession. There's a big vein that runs here, right? So if you have like a really tight jaw and recessed, there's going to be less blood flow to the scalp, right?
Right.
But that alone is not going to kill the hair. You have to combine it with a lot of inflammation, the DHT, and the craniofacial dystrophy, and genetic factors. There's a lot of different things. Like, not everybody's going to have the balding, but we know that the main treatment for benign BPH or prostate cancer is DHT blockers, and it's not the only way to treat it, and it's not going to cure anybody of it, but it's very well known that it's a big mechanism in driving calcification in a lot of different tissues. And one of the things that happens when you have the sleep apnea is that your blood oxygen level is dropping, right, constantly. Yep. And it's either at a lower, it's going up and down, but on the average oxygen level is lower. Plus, you have way more inflammation. And so the enzyme that's active, the enzyme that converts testosterone to dihydrotestosterone, DHT, is heavily upregulated when there's a lack of oxygen. Like, so the regulation of that enzyme changes a lot based on the oxygen level in your blood. So even if you have like a normal amount of tests or whatever, or just a normal amount of every steroid hormone, if you're in a really inflamed state where there's not a lot of oxygen, your body's preferentially going to have less testosterone, more DHT, because DHT is a stronger androgen. It's many times more potent than testosterone on the androgen receptor, and so it's also going to have higher estrogen and progesterone, potentially prolactin, but it's partly to there's a host of reasons, but partially to make up for to partially assist the inflammation and the damage that's being incurred on your body when you have no oxygen, combined with the fact that you can't get into a normal sleep cycle if you have sleep apnea.
That's just crazy as fuck.
So that is definitely connected to the balding. But there's a whole rabbit hole. But with the UARS, if you think about like how if you have UARS, right, you have restriction here when you're breathing. That is going to create a negative. It's going to create a negative pressure, right? So if you guys might like, if you guys work out at all, or do certain things, there's something called the Valsalva maneuver, and you're basically just bracing for exercise, right? You like take a deep breath in, you flex your abs, right? If you want to flex, like you start to get veins in your neck, whatever,
right.
People are flexing. That is creating a positive pressure around your heart, right? So your heart is it's increasing your blood pressure by squeezing your heart and pushing more blood into your veins. That's why, that vein comes out if I hold my breath and like squeeze, right? And the same thing happens. So when you have UARS, right, you're having the negative pressure on the inhale, and then you're having positive pressure on the exhale. Let alone if you have sleep apnea, which is literally just like a complete positive pressure and negative pressure. That there's no opening. So that negative, depending on like how much of your sleep, if you're constantly, let's say in, if you're, if you're constantly having the negative pressure in your throat and your airway, it's much more common that you're gonna have things like acid reflux. People with sleep apnea that have that negative pressure, it is often pulling the acid out of your stomach a little bit. And in the Valsalva maneuver, when you're bracing like that, there's these muscles that are connected to your balls, to your testicles, and it's like, how they do that when you go to the doctor's office, right? And they'll like tell you to cough and they'll check your balls. That is there's a muscle, right, that runs up through your stomach that is responsible for that. And that over time, if you're unable to force air out of your nose, before your brain wakes your body up your brain up from sleep, it's going to try to push the air against whatever resistance it has. So a lot of people can breathe in and snore on the way in, but then when they try to exhale, they can't exhale at all. Like I have that a lot.
Yeah, that happened to me too.
Yeah. So when you're creating you're disrupting your sleep, but two, when you create the positive pressure, you're basically like, you're forcing, in the same way that you're forcing blood into all of your veins throughout your body, you're also forcing blood into the testicles, and then the veins coming from the testicles that come up into the body. And so those veins, when they become enlarged, they're called varicoceles.
Right.
And so they become tangled, they become like swollen. And a lot of that is due to there's at least some connection to the positive pressure that people experience during sleep apnea, and that varicocele formation and occurrence,
in the testicles, right? So
yeah.
So you're saying that like increase in pressure can really have an effect on not only like,
well, it's increased in pressure. So increase in pressure, like increased blood pressure specifically, is causing damage to your arterial walls, and to a much lesser extent your vein, the walls of your veins, because the pressure is mainly in the arteries. That's why you get like atherosclerosis, which is it's in the arteries, right? It's not in the veins. You don't get atherosclerosis in the veins because there's not positive pressure to the same extent. Obviously, there is some, but so if you combine the positive pressure into the testicles, combine with the lack of oxygen, right? And then your body's producing a lot of whatever hormones in your testes, right? But in your testes there's specific enzyme activity that is different in each tissue. So like your scalp has a lot of 5-alpha reductase activity, which is what converts the testosterone to the DHT, right? And your genitals, including your balls, have a lot of that activity as well. So when you're forcing a lot of blood through there, you have a varicocele, which is also very common to be associated with sleep apnea and prostate cancer, right? You set the ratio of testosterone to DHT is going to be much higher in that area. And there's some evidence, it's not like a super, super strong research behind it, but there's definitely some evidence that those two are connected in terms of why there's a connection to sleep apnea to prostate cancer and varicoceles, because it's not just the lack of oxygen, but that is a big part of it, because that's skewing. You're creating androgens that are way, way more potent, but there's just less of them. So you're going to have more calcification because there's more androgens and because there's less oxygen.
I guess a question I have, like, next to move on to another topic, would be something we were kind of like talking about earlier. But before we do that, is it because women have tight skulls? I mean, I don't really know what that means. I guess tight skin, tight skulls. Like, I'm not really sure what that means.
Did someone ask that, or are you?
Yeah, somebody said like what you were talking about. I just, like, briefly, if you know what he's talking, I don't really understand what he's saying. Quickly, before we move on.
No, they don't have tight skulls. I think actually men have tighter skulls, but
density wise,
that's a weird like way of describing that. But if you look at, like, I wish I could
maybe small. I'm not sure.
Well, no, they're really the hormones change how your bones develop. Like, they really do.
Oh, they have like a thinner face, basically, like, is what he's saying, I guess.
I don't know.
Maybe not.
It's really because in terms of the hair loss, it's because of their estrogen. Like they have way less DHT. Like, the only time women start to bald is when they go into menopause and their androgen levels start to go up in comparison to and their estrogens plummet when they're older. But if you look at, like, people that have their pituitary doesn't function and they haven't gone through puberty. I watched this one guy's video. He was like 25, he was tall. He didn't have like a growth hormone issue. He was tall, but he had no masculine features at all, and completely 25. Like, he's very much an adult, and his hairline, like the shape of his head, right, is sort of. I wish I could probably find photos, but like the way his hairline sits, and this is very common before you go through puberty as a guy. Like, the shape of your head, especially this part of your head, this round part, is different. Like, it's not like shorter, but it's like it's just a different shape because of the hormonal activity. But if you look at these people that start at 25, when they have no puberty, they've never had androgens, and then they go on hormone therapy, even at 25, once the growth plates, well, it might be different in that case, but supposedly the growth plates are closed because he's not growing taller. their whole head changes. Like it's not just that they grow a beard, they're a little more masculine. Like they're all of the shapes of all the bones in the head change. Um, just because of the testosterone, like that the hormones are very powerful in changing how the tissues are expressed because they're nuclear receptor. The steroid receptors are nuclear receptors, meaning they're not just like on the outside of the cells or the neurons. They go inside the nucleus and then change how your genes are transcribed. Right. So if you just if you don't have any testosterone, you're not going to have masculinizing gene effects. Like but if you have testosterone, it's the same reason that if women take testosterone, they have masculinizing effects.
Okay.
So it's very connected to hormones, and that's why I do think that person who was asking about the TRT, it makes sense that you want to ask about that because like it's true that you aren't experiencing the same amount of masculinization if that's what you want. That you would be if you had normal testosterone. But obviously the caveat is that you don't want to do that by just injecting yourself with testosterone, especially if your balls already work.
Right.
It's more important to just get rid of the estrogens in your diet and the plastics, fix your sleep, fix your airway.
And those are all things you can control too. Like those are things like you can actually take like an active role in doing and trying to change, because there are people who are like, oh, I'm so lost. Oh, I'm done. My life's over. Blah, blah, blah. I can't afford this. I can't afford that. But it's like, bro, like you literally stay up all night. You're on TikTok. You're on YouTube Shorts. You're not like getting your sleep right. You're still eating junk food. You're, probably microwaving plastic. Like BPAs are all in your system. Your estrogen is all over the place. Like your hormones are fucked. And there are literally things you can do and you can change about your lifestyle. Go to the gym, drink only water, cut out bad diets in your life, and bro, like your life will change. Like I hate people who are like, oh my God, my life's over. Oh my God, I'm ugly. I'm this, I'm that. Like, bro, shut up, bro.
Yeah.
Like literally shut up.
Well, and I mean, because I'm not opposed. I'm genuinely really not opposed to. I'm really not opposed to just experimenting chemically, I guess. Like I've done a lot of experimenting. I mean, not as much with hormones, but like I'm really not opposed if you genuinely just want to do it, or want to get on TRT or feel like it is necessary, that's fine. But just get the most out of it, like don't just like do it as a quick fix. Like if you just don't fix any of your issues in sleep apnea and then you take a bunch of testosterone, like it's not, or growth hormone, like it's not going to just magically fix your issues and you're going to become a masculine Chad or whatever. Like you need to fix your sleep, you need to fix your airways, you need to fix your diet. Like you can't smoke, you can't be smoking. It's just all these things. Like it's not. People are going to do what they're going to do, obviously, but you're going to get.
Don't complain to me.
You're going to get
trying to change.
Yeah, you're just going to get so much better results if you do end up going on TRT. If you actually have your lifestyle in order and you know anything about the chemistry involved, I think it's really important to know at least a little bit.
That's true. There was one thing you talked about like last time we had a conversation, and I was like, how like attraction from women, like how it changes like hormonally when in their minds, like if they're on their period, or like I guess what is the biological attraction dynamic between men and women hormonally, like naturally, and how does birth control change this natural attraction as well as like women's menstruation? Like somebody was mentioning, women are more attracted to men that are more feminine looking, or X, Y, and Z. And how would you describe that, and can you go into detail about that?
Yeah.
Because like I guess like before, like to go into it, to dive into it, just briefly cover the attraction dynamic hormonally, and then go into birth control, and then period.
Yeah. Well, so there in women, when you're going through your cycle, you're gonna have when you're ovulating, there's throughout the cycle there's basically a stable level of testosterone, And then when you're ovulating, there's a little bit of a blip and spike in testosterone, right? That is associated with the release of that egg.
In women.
Yes, in women, of course. I hope. Yeah.
I hope you're not ovulating as a man.
maybe you've got both going on.
Maybe in the state of California, but
Yeah.
continue.
But what am I saying? So during that period of when during ovulation, when the testosterone spikes, the person is referencing, I mean, many channels have talked about this, but there's a few studies that basically have women both during ovulation as well as not during ovulation throughout the whole cycle. They rate a slew of men based on attractiveness, and I forget what other parameters, mainly attractiveness. But when they're ovulating, they're attracted to more stereotypically masculine features in their partners as a whole, right? On average. And then when they're not ovulating, when the testosterone's not as low, not as high, when it's lower, they're attracted to slightly more feminine features in them, in their partners. That's the main study that people are referencing.
Okay.
But when you get on birth, well, do you have a question, or?
I was just gonna kind of just go ahead.
So when you get on the birth control, what you're really doing is most birth control is a little bit of estrogen, a little bit of estradiol, and then a progesterone or progestin, which is just binding the progesterone receptor, to send the signal that you're pregnant to the woman. And it is obviously it is castrating essentially the woman, right? Stopping ovulation, and stopping hormonal production, because the hormones, before you go through menopause, your hormones are coming from your egg, right? They're a lot. The bulk of them is coming from that egg release, right? So if you're just taking a bunch of estrogen plus progesterone, both of those things negatively downregulate the production of testosterone. And so in women, the testosterone is still the most dominant hormone in terms of percentage, like ratio wise. It's still more prevalent than estrogen in women's bodies or any other hormone, but just obviously we have different proportions in men. But when you take the birth control, you're shutting down the bulk of the testosterone production, right? And so in women, this is not just like, oh, women don't need testosterone. It's very important for women to have testosterone.
Okay.
Like no woman wants to have no testosterone. That would feel horrible.
Right.
And so, but what happens on the birth control is you're inhibiting all the hormonal production, you're inhibiting the ovulation, and you're inhibiting the testosterone production. So you, on average, in the same way that you're attracted to different people when that women are attracted to different men and more masculine features when they're ovulating, than when they're not ovulating, when their testosterone is a little lower. When you're on birth control, it completely drops your testosterone and your androgens to a fraction of what they were, and you ended up being attracted to less masculine men in the same way. And
on birth control.
Yeah.
That is really interesting. That is very interesting. So like, let's say you get like an IUD or one of the things that goes in your arm for like 3 years of birth control. That typically that will literally change like your attraction to a man. That would make you.
And well, it will change your, which partners you pick. I mean, what sort of like relationships dynamics that you prefer.
Right. That's so interesting.
A lot of different things.
So like, let's say like, I guess the next question would be, how does sex like affect these hormones, and what does semen retention, and how does that affect like, I guess I wrote that wrong. Oops. But how does that affect like your attraction or someone's attraction to you? because someone said like semen retention makes you a Chad, right? I guess like there's a lot of studies that say like, you know, semen retention doesn't really change your hormones, and that ejaculation doesn't really change your hormones. It does temporarily. There's like a boost in a week, but then they drop back to normal. But I don't think what is not being taken into account is like long term, let's say like 3 months. Like your base test levels, I assume, would increase when you're not having sex or reaching like a climax or releasing, I guess people say like your life force. But I don't know. I think like you mentioned this briefly when we were talking about it earlier, but from what I understand from this is that when you are not reaching climax, or you are not watching porn, or you are not having intimate sex with the partner and reaching ejaculation, your body goes into a state of go, because you are not, and like go into the details of like the hormones, because like you know more about it than I do.
Well, I mean, so there's definitely that study that you were mentioning, where they noticed the biggest increase after a week of abstinence in testosterone, and then after that it would drop down. There's not a ton of research on it. There's a decent amount, but there definitely could be more, in terms of like all the different ways that people do the semen retention and nofap. Like there's, people do it for different periods of time. Some people do it always, even if they're with a partner, versus like some people will just do nofap, and unless they're with a partner, then they'll come, and that's very different. And I don't think there's that many studies really. But it is a bigger increase if you are having sex but you don't come or ejaculate, versus if you were doing semen retention but you were still having sex a decent amount of the time and still orgasming. You're not getting the same benefit. But the main effect is there's a lot of different mechanisms that it could go through, but a large portion of it is due to the prolactin increase.
Okay.
That happens after men and women orgasm. Sorry. And like that, like the prolactin release. So I forget what his name was, but Ron interviewed this guy. You might, some of you in the chat might know, but the guy that was like smoking a bunch of cigarettes and just like super ADHD.
Aiden.
Yeah.
Shout out Aiden,
great.
bro. He's in the chat.
So
he's here, I think, and he's also in the Discord.
But yeah, so he mentioned he was talking about what's it called? How a lot of people with recession and sleep apnea will self-medicate with porn addiction, right? Or masturbation addiction.
Right.
And I personally have totally experienced this because the prolactin, I mean, most people like obviously feel that tiredness after they come, right? But that is a lot of that is due to prolactin, because it's directly inhibitory of dopamine signaling, and vice versa. Like if you have a lot of dopamine signaling.
Prolactin is what hormone? What is that? What does that do?
In men, the main function is after orgasm. However,
so it just calms you down, maybe.
It does a lot of different. It has a lot of different downstream effects, but it antagonizes dopamine, right?
Okay.
Like
it's like post-nut clarity, basically.
Yeah, basically. Like
okay.
That feeling is a lot of different things happening, but when you have like if you take you know how people take like Adderall or meth or whatever, and like they just can't stop having sex, can't stop masturbating, right? That is because it is agonizing or releasing or inhibiting the reuptake of the dopamine, right, in your brain, and that dopamine is directly antagonizing the activity of prolactin. And so in the same way that if you have a shit ton of prolactin all the time, if you have a pituitary adenoma, right, that where it's just your body's spewing out absurd amounts of prolactin, like abnormal amounts, you're gonna be tired all the time. You're not gonna have motivation. You're gonna have a hard time concentrating. It's the same thing. But I totally agree with Aiden about the that being a sort of a mechanism of self-medication in some way with the sleep apnea, because a lot of times, like in these people that are already high strung, like you cannot go back to sleep. Like if your body's just waking yourself up, and shooting adrenaline and cortisol into your body, it's not gonna magically like you make, like adrenaline is made from dopamine, right? And so if you make a bunch of adrenaline, right, they're going back and forth, but in equilibrium. But if you're producing while you're sleeping a bunch of cortisol and adrenaline and a little bit of dopamine, it's going to be harder to go back to sleep, right? And especially if you think about it, like the the DHT, yes, so the impulse control. So with the DHT connection that we were talking about earlier, if you have a bunch of DHT floating around because you have no lower blood oxygen level, DHT is way stronger of an androgen and way more potent of an androgen in how much it binds to the receptor. But you will absolutely, especially if you take like DHT derived steroids, you'll really experience extreme sex drive and aggression, like to a level that most people experience that during puberty, and that is largely it's DHT. Like if you take like finasteride or Propecia or whatever, like the 5-AR inhibitors, the ones that for hair loss or for the prostate, a lot of people experience significant decreases in their sex drive, and that is a lot of that's due to DHT. So you can imagine, like if you already have sleep apnea, you have worse sleep, you have a hard time going to sleep, and then a hard time staying asleep, that it would make sense that your body is like, I need to just like down regulate, and I have no other way of doing it. So I need to just get my aggression out, and then I'll get the release of a bunch of prolactin.
Right. Yeah. I mean, a lot of guys can probably like relate to being addicted to masturbation at least one point in their life, and how that like affects, your mood, energy, maybe like as a preteen, but now it's like as you grow and as you age, that really has an effect on your ability to, let's say, stay disciplined or, impulse control, like he was mentioning, and how that affects like, just in how that correlates with sleep too. So that's really interesting. But yeah, shoot, I want to like ask the chat, what direction this can go in. I know we have more things to talk about, but I know we have the tongue ring or the septum ring for face masks. That's pretty cool.
This guy, I'm gonna vape hard, so I'm dead at 40 because it's open. Oh my god,
bro! Hold on, I think I saw that shit.
Someone suggest me the way to live a short life.
Brothers, man.
We can recommend.
Nah, we don't want to get demonetized.
No,
just do the opposite of everything.
Hey, people aren't getting monetized. No, yeah, do the opposite. But hey, steroids shorten your life a lot. So
that is true. Look at Conor McGregor. That man looks like he's fucking 50 years old now.
Yeah, that is not good.
Fapping is easy dopamine, like junk foods, but worse. It's easy to get addicted to it, and by doing so, it will burn your dopamine receptors. That is true. That is very true. Porn is actually very bad, and even just repetitive orgasms can, you know more about this than I do. I need some fucking coffee, so I'll be right back. You can go ahead. Okay. Before I go, how old were you guys when you started mewing? I'm 22 and just started. I was about 17, and that's like right around when I got into braces. But I learned about mewing around like 2019, and I noticed a decent amount of changes, at least just breathing through my nose. But yeah, what about you? How old were you?
Well, I honestly just haven't, like, the way my bite. Yeah, the way if you got, well, you guys don't know my history, but I mean, unless you maybe you watch my interview, but I I really haven't been able to do it properly just because I don't have enough tongue space.
Mm,
Um because partly because I played a lot of saxophone, the muscle, oh, that's another thing we have to talk about. The muscle of my tongue and my throat and my jaw is very developed, and especially when I'm playing saxophone a lot, my tongue hypertrophies like any other muscle, uh like a crazy amount. And so I can't, I mean, I just can't, like, actually technic like, I can do it correctly and I can kind of breathe, but it's like I need a wider palate and more tongue space. Like, I only started it once my growth plates were closed, so that it's not really. Yeah, I was like 20 something, early 20s.
John Mew says adults can get significant transformations with BioBlock. I think he's tripping. I don't. I mean, maybe he'd probably know more about it than I do, but personally,
I
I
mean,
don't see it.
maybe it's
Maybe in
easy.
women.
Yeah, maybe it's easier in
Oh,
women.
like yeah. Like some adult females have gotten significant results from tooth-borne expanders. Males, no. See, I
Yeah.
agree with that statement, but a generalized statement like the BioBlock can do it in adults. It's like, okay, well, what ages and what
Yeah,
type
well,
of
there needs to be a way that people that these practitioners that can like approximate how easy it's going to be for a person, just based on the hardness of their sutures. But maybe you could do it through a hormone testing, like if there's a guy that comes in, like, who has no facial hair, has no masculinization, right? Maybe, and you test their hormones and they have low testosterone and just low androgens in general, then maybe it's more likely to work in that case. But even then, like, the just being a male with some testosterone, like, your genes are going to respond differently to the testosterone that's there, even if it's less. Um, yeah, I wish. I mean, I wish that the tooth-borne expanders would work, in males, but, or at least consistently male adults, but seems pretty unlikely.
God damn, bro. I hate Reddit so much.
Why is that?
It's full of idiots. That it's just people who are dumb, bro. Like straight up dumb. Here's a wow. If I could I guess orthodontics. I want to share my screen and kind of talk about this because there was one post
Yeah.
I made, and these motherfuckers are just so dumb, bro. Like they annoy the hell out of me.
I'll be right back in a second.
Go ahead. Do it again, yo. Do it again. I had to do it again. Um. So yeah, guys. We're gonna go on Reddit now. We're just kind of like just look at a lot of what people have to say. And there's a lot of people on Reddit who like have absolutely zero idea what they're talking about. And it's really sad because there's like hundreds of thousands of people in these groups that just sit on this hill of power. And I never used to go like ever. I would look at Reddit and be like, bro, that's so insane, bro. Like, get that. I'm not doing that shit. But I don't know. Just like ever since like diving into this, I kind of just started like really thinking about like, oh, what does everyone have to say? What does everyone think? What is this? What is that? What is that? So just going into this, like, I really think like, here, let me get off of this, motherfucker. Let me get off of this. So just going into it, like it brought me to these like people, bro. It's just so sad, man. It's so sad, mate. So sad, love. But let me share my screen and we can kind of get into it. Feel me? Get into it. It was like what? Shift S. Share. Do it again. Do it again. I'm about to do it again. All right. Hopefully y'all can see. All right, hold on. All right, hold on. I gotta find it. I know it's here somewhere. Orthodontics. So I made a post. Well, somebody made a post. Definitely not me. Totally not me. Made a post about the current standard of orthodontics, and I really want to talk about it because it's actually like really important. And like I made a really good point. A lot of people are just like in the comments like talking hella HRT, the bad word. So let me just share this with myself, and hopefully y'all can't see this because if you see my messages, that would be sad. Do it again. I'm about to do it again. Y'all can see, right?
Hey.
Yo. You can see my screen?
Yeah.
Okay, what if oh wait, I gotta shift S. Bow. All right. Can everybody see? Can you see? Yes, I'm assuming yes. All right. So someone made a post, says the current standard of orthodontics is barbaric. Prove me wrong. Retraction and extraction should not exist. Expansion equals prevention of crooked teeth. The airway should be the number one priority, yet CBCTs aren't even standard. The Orthodontic and Dental Index both use studies dating back to the 1950s to teach orthodontics in 2023 how to identify malocclusion. The fuck? How could you, as a human being, morally justify shrinking somebody's nasopharynx, oropharynx, and move the hyoid bone and or extract wisdom teeth without offering skeletal expansion? Knowing the alveolar bone dissolves by 50% within the first year of extraction and assume this has zero impact on the face or airway, and then tell the patient the only route to reverse this is surgery when MSC exists. Absolutely pathetic. Do not use, oh, well, there's not enough evidence excuse, because there absolutely is, and you are in denial to think surfacing research of this magnitude of negative health impact shouldn't raise questions of morality. So I'm actually interested to know if you are an orthodontist or dentist. We're not going to get into that. Had extractions of premolars for my braces due to overcrowding and my mouth protrudes, leaving me with a lip incompetence. I was told the extractions would better my face, but I was told this is going to be a big regret since I already have a recessed chin. So let's go to this. Sure, it's ideal, but what if the patients can't afford ideal treatment? Orthodontic surgery, SARPI, MARPI, etc. What if the patient values other benefits to alternative to TX? What is TX? Treatment, duration of treatment, Jesus Christ, risk of complication.
I think that most of these people really don't. I don't think they're like in denial. I think they just don't. They're not reading any of the research at all.
Right.
Like, of course they're not. Like, these people are not. Average orthodontists are not reading research. Same thing with any doctor, really. Like, don't read research that much unless they're really good. Which I know that Yusefian contributes to research. He writes his own research, and
I think that should be like standard. Like if you're not like up to date on the current research, or at least like emerging research, like bro, like you can't just go to school for something. Like, I don't know, bro. It's just a problem within the standard and in the school. Like they just don't really like update the information. They don't update what it is that they're trying to learn and stuff. It's really sad. So there was just one point I wanted to make, or at least that I saw. Just basically hold on. Anyways, this person tried to say extractions can happen, it's part of treatment, yada yada yada, and that it's normal and standard. So, extraction should never happen unless the case is so extreme the teeth are legitimately impacted. MSC plus Bezo allows the suture to be split at any age and allows true skeletal and nasal expansion. MSC is in a league of its own, and skeletal expansion is not tooth-borne like AGA, homeoblock, DNA, etc., further proving orthodontists' ignorance towards expanders. So somebody even mentioned that expanders like aren't even taught that well, like especially in adults in dental school. Like, that's insane. Like they're not even like taught MSc is an option. So of course they're just going to be like, oh, surgery, and that's
Yeah.
just insane. We don't
Well,
have
in the same way, I mean, I think we talked about it a little bit, but in the same way, in the same vein, you know, Yousefian, but all these doctors, right? They're in the meantime while you're fixing the airway issue. You know, you're not. Most of these people are recommending some sort of pharmacological intervention. You know, some sort
Mhm.
of drug intervention
Right.
in terms of like helping you sleep, but you know, in the same way, like they're in a similar way, because it's not really their field partially, but they're just really not educated about sleep and how it actually works. So they end up prescribing these medications that don't actually help you sleep and are worse for your cognitive decline from the sleep apnea. You know,
Right. Like the
um,
pills you're talking about, like the sleeping pills.
yeah, like a lot of people will recommend like antihistamines, like
Like
Benadryl.
Benadryl, yeah.
Yeah, but it's directly it antagonizes the acetylcholine receptors, and in the long run, if you use that for sleep for decades, you will have cognitive decline and basically dementia. Um, yeah. Um, but that's sort of another topic we could talk about
For
in terms
sure.
of managing the sleep apnea. But
Absolutely.
um,
Um,
do a lot of people in here have sleep apnea? You guys, seems like a decent amount of you'd have it. Um, at least to, when you and I were talking last time, even if like the threshold for diagnosing uh OSA is, I think, like a 5 AHI, right?
mm,
um 5 or more. And even you had like a 3 or something, or a 4.
yeah, it was like right below the.
Yeah, well, so like even then, I think that compared to having like a completely uninterrupted breathing cycle for all of your sleep cycles, versus every single hour and a half sleep cycle being interrupted 4 times, like that's still a lot to me. Like it's not nearly as bad as like 15, 20, 30, but
Right.
that still has to be disruptive in some way.
Absolutely. What was question? Yeah, mild OSA 5 to 15 AHI, but AHI. Now here I am, 21 years old, like motherfucker, like, I'm not overweight. I had no previous sleeping, breathing problems, and then I go into an ENT, and I get a sleep study, and I come back with an AHI score of 4. Like what? Why is it 4? Like what is considered, is UARS even considered like a serious, thing? Is it even considered a factor for sleep related health problems? Am I going to develop, any sort of long term brain damage, long term cardiovascular issues,
Yeah,
or
well, I mean,
cognitive decline? Like that's insane.
well, even just the negative pressure combined with the fact that the like the airway is at its max that it will ever be when you're like 20, 25. It doesn't really ever get bigger than that, and it always goes downhill. Even if you don't have sleep apnea, it will get smaller over time. So if you are already starting at 5, there's no reason that it can't just like keep continuing up when you're into your 40s,
Mm,
50s. It's very common because, like, I mean, I don't know if what my dad had, but what AHI he had when he was younger, but certainly he was probably in the single digits, and then it increased a lot, you know, when
right.
he got older, just without any facial changes or teeth changes. Um, so
Wow.
so
Yeah.
but yeah, I think the UARS is still an issue on its own, but it's like it's hard to distinguish like who has just UARS versus who has both or just one of them. Um,
I just asked if UARS was underdiagnosed, which obviously, it is, but it's hard to like test for it, like you were saying. Like it's hard to even like know if you have it or if you were just, you know what I'm saying? Like there's just so much that goes into it. And I think 10% of people with sleep apnea, or excuse me, 90% of people with sleep apnea didn't even know they had it,
Yeah. Yep. There's plenty of research on that. Yeah.
Like that's insane.
It's very underdiagnosed.
Very sad. Yeah, man. Do you have anything more you want to talk about, or you just kind of want to feed off the comments and just kind of chat for a little bit longer?
Let me look through these. What is RDI?
RDI sleep apnea. RDI stands for Respiratory Disturbance Index.
Oh, I see. Yeah.
Wow. Bro, Chat GPT, bro, this shit is goated, bro. That's just a new Google.
I barely used it, but it's pretty crazy.
Yeah. Yo, there it is. Y'all talking about the fight, bro. John Jones is winning that shit, bro. That man is too smart. His fight IQ is off the charts, bro. His facial structure is extremely developed too. I think like him gaining weight and just like, I don't know. I think it's like grown. His face is actually growing forward. His body fat percentage definitely went up, but I think his overall structure is actually improved. Here, wait. Let's look at I want to see if we can pull up John Jones facial structure. Oh, that's kind of images. So here he is now. Wait, no. Here he is now. There's a better one. See if we can zoom in. See how much. I mean, he has more body fat now, but I just think his face and even his nose is just like wider. Like his cheeks are wider. His maxilla seems more forward. It could just very well be, but the thing I've noticed more was his brow bone. Was much more forward. But if we compare it to, let's say, when he was in, look how sharp his face. Oh, that's not it. Look at this man, bro. That's a killer, bro. That man is a killer. But hold on. One thing that's really interesting. Here we go. That might be. See how like his eyes are kind of sunken in. This could just be body fat as well, but he's in his 30s, and look at this, man. Beautiful facial structure. And one thing I really want to look at is Conor McGregor. 20, let's say 15. All right, look at this, man. Hold on. This is when he was at 55 or 45, actually. Look how strong his cheeks are. Look how forward his lip is. You see how there's like a very minimal crease in his cheeks right here? I mean, hold on. I'm too zoomed in for this shit. But like, look at him. Look at this. This is a beautiful picture. Beautiful representation. Look how recessed his maxilla is. I know he's smiling here, but just look how like he's obviously on fucking steroids in this picture. But like, look at him now, bro. Just his mannerisms. Like, it's just he's drugged out, of course, but like he has veneers. And his face has changed so much. His voice has changed so much. Like, look at this. No wrinkles, no, like his maxilla is forward. He actually had extractions too. And now he has veneers, so his biting force isn't as strong.
Oh, that's a good one, right? Go down. Which one? Go down to the where he's bleeding from his head.
This one?
Go down. No, go down. You've got that one.
This one. There we go. Side profile. I think this is his fight with Eddie Alvarez, where he did get cut. But yeah, like look at how forward his forehead is. His posture here is actually pretty well. He is kind of turned to the side, but Like his maxilla is forward, his chin looks stronger. He does have a beard, but like his face was so strong and so developed, and now it's just like he looks here
Yeah,
sick.
a lot of it are these growth hormone releasing peptides that they're using. Yeah,
Yeah,
that's definitely what this because it's
look at his
not.
can't.
Oh yeah, true. It's definitely like because I mean steroid users do get that sort of creasing here, but
Yeah,
it's way more common that it's either steroids plus GH or GH on its own or some sort of releasing peptide.
right.
Because that's clearly you can see in his face that big bunching here.
Mm.
Plus
And that
everything
little
else,
like triangle,
the water retention is just really high.
right? I just like there was one specific picture I shared with my friend who I've kind of like he's really into the UFC and I've kind of like brought up every time McGregor would post. But like here's a good one. Like look how like everything is back. Like I don't know if that's a really good picture, but he's like look at his eyes, his brow bone, his maxilla is just kind of like brought back. Even this one. Oh wait, that's not good. I don't know. His face is just recessed. Of course he looks fucking jacked, bro. Like but just compared to like what he did look like and what he was at, it's so sad, man. Like I just
Yeah, I'm sure the
he was
veneers didn't help.
yeah, like just he looks so different, bro. So different. Like his smile, like his oral volume is much less than it was. Like here's a good one. See how we kind of like his cheeks come out more and
Yeah.
his lips are back.
Well, he
Like, this
mouth
is
breathes a lot too.
oh, a lot of his fights, yeah, he gasses out pretty early. He's also a first round fighter, but like here's one. See these? See how his like eyes and cheeks are kind of back, and his upper
Yeah,
teeth are
definitely.
like really recessed. Like, bro, like that's sad. Like, I mean, of
Yeah,
course, like that's what
his nose. I mean, well, I mean, obviously, he's been hit in the nose a million times. So, but his nose looked different
yeah.
too.
Like even here, how it kind of like dips in, like dips down. It flexes. Like there's more soft tissue there for it to move around because the maxilla isn't forward and there's nothing really like supporting the nose. That's kind of like what happened to me. But like as you can see, like that's probably from the testosterone or the TRT he's on, kind of added like more soft tissue here. But it's still very obvious that just look at this, like how far back his maxilla is compared to where it should be. You know that all that space in there. I know it doesn't look like a lot, and how his bottom jaw is more forward. He just seems very like collapsed and recessed. So, compared to let's say. Khabib's face. Like, look at this man's face. Look at how strong his brow bone is. He has hunter eyes, bro. Look how wide his cheekbones are. He has a very wide, broad, strong face. He's also Islamic. In their beliefs, you are supposed to be breastfed. It is the child's right
Yeah,
to be breastfed. Now, if we look at somebody like Islam, for example, his face is actually kind of recessed. I mean, he has a strong brow bones, of course. That might just be genetics, but he has a very long face. Like in his last fight, he was getting pieced up by Volk, and he was actually feeling it. Like I think Islam's mid face is actually recessed, and I saw a training video he was doing with the Nelk boys where he was running outside, and he was mouth breathing every single video I saw of him. He was mouth breathing, like even here, mouth breathing. I think this is the end of the third round. But like I don't know. I think he's slightly recessed. His brow bone is definitely very strong, but I don't think he has like the strongest chin. Here, I'm trying to see if I can get a good picture.
yeah. I mean, think about Tate.
Oh, bro, he ran and a lot of his older videos, you can see how recessed his chin is.
Oh, very, very. Yeah,
And he also ran like a website business or like with the chat girls or whatever. Like here's a
yeah,
good one. Look how recessed his chin is compared to like the rest of his face. See how kind of like
yeah.
angles downwards and his chin is kind of like recessed. He looks better now, but like look here, bro. Look how fucking terrible that is. He also didn't really have the best diet growing up. Once he got to like his mid, 20s, they were kind of broke, like he was saying. So they didn't really eat a whole lot of food. They lived in England. They were eating beans and stuff, so they weren't really stimulating any sort of like jawbone. But like, look at this. Like, he
Yeah.
definitely
Well,
has. Like,
you just never know like what series of events like lead to the recession because
Yep.
it's I don't think like I think that some people in this group like over attribute certain facial changes to just simply diet and um, breathing. You know, because I
yeah,
think that if you look at his brother, like he's not recessed in the same way,
yeah.
and he's not that
Tristan
much
is not.
older.
Yeah, look. I mean, Tristan's
Just
face is much more developed. Here's a picture of Tristan, but
like he could have got. I mean, there's so many things that could have happened, but I don't know.
yeah, it's
I
just
do
like
think there's definitely some genetics to it, but
agreed. But I think like as of recently, like I think he looks not as recessed. But even like Joe Rogan, bro, his face collapsed a lot too, and he uses a mouth guard at night to sleep. So his
but you
tongue
said
isn't
he had
even.
didn't he have veneers put on or something?
Joe Rogan, I don't know, maybe.
Maybe it was just
He
an
might have had
accident.
wisdom teeth pulled, but his genetically, his fucking head is just humongous, bro. He is a fucking huge ass head. Um, so it's interesting. A lot of people with bigger heads and larger nasal cavities and more developed airways are typically better speakers. I think correlating to the temporal lobes and how that affects like brain atrophy. Joe Rogan is one of the best speakers I've ever seen. He's very good. He knows when to talk, how long to talk for, when to comment, the right amount of enthusiasm. Like it's an art to it, and Joe Rogan I think has mastered that, and partially I think that's because of how developed his temporal lobes are and how large his airway is. And I think if you look at artists, a lot of rappers, a lot of very popular mainstream artists, their faces are typically very well developed and they have large nasal cavities and airways. But I'm not going to get into that. But look how forward his head posture is. I think when he was working on the cams and in the cam business, he was sitting in a chair, head forward, bad posture. I think that also attributed as well as the.
Oh, look at the chat. Will put something. I put that up there.
Let me see.
Andrew had asthma.
Tristan deny Andrew mouth. He actually has lung cancer now. That's interesting. Andrew had
Apparently,
asthma. Tristan
apparently
deny.
it's benign. Apparently it's benign.
Oh, really?
Yeah.
Yeah, that's interesting. Damn. Well, at least he's not gonna die. Hope not. That would suck. What extractions did McGregor have? I remember John Kavanaugh, his trainer, mentioning something that he had one of his teeth were impacted or something like early in his UFC career, and he just waited and waited and waited, and then I think when he started getting money because he wasn't fighting, because if you get a tooth pulled, like you're gonna be out for like maybe a month or two, especially if you're fighting. But what extractions did he have? As much as I know, just one of his wisdom teeth, if not all of them, and then possibly molars for the veneers, and then he had his teeth shaved for the veneers, and then possibly retractive elastics or some sort of Invisalign. Because I remember he had Invisalign after the Mayweather fight. So but he definitely got veneers. His face is extremely recessed, so that's really sad. And all of his old kickboxing vids, Andrew's mouth breathing. Yep. So it's actually really sad. Connor actually doesn't have veneers. He just colored them. I don't know, bro. I don't know. I think he does have veneers. He has like brand new fucking teeth. Them bitches are like pearly white, and they're like a perfect like U shape. And they're actually like, if you look at pictures of him like screaming here, I don't know if I could find it, but of him screaming back in the day, like his mouth is just so much larger compared to what it is now. So I guess maybe he could have just had extractions and then colored them. But you could be right. Look up BT Sports interview with Ariel Lonnie, and Connor says he could just be lying or capping, bro. But I believe you. I think he does. I guess another person with like really strong facial genetics is Francis. Look how fucking huge this man is, bro. Extremely well developed. Very strong, very wide cheekbones. He's never getting knocked out. I mean, he got beat the fuck up, I'm not gonna lie, but I mean, he's never gonna get knocked out. Like these people with like just so strong like facial structures compared to like let's say like Darren Till. This man's face is so narrow. He has strong brow bones, but like look how recessed his cheeks are. Look how flat his cheeks are. Look how narrow his nose is, and he's been getting beat the fuck up the past couple fights. You know, like, bro. I mean, of course he's fighting crooked ass nose, probably been broken before, but he has a very like look at his cant. You know, it's like fucking offset a little bit, and his oral volume is very small compared to other fighters that have typically a stronger chin. Like George St. Pierre has a very strong face. At least like back in the day he did. Like look how strong his wide his cheekbones are, very forward maxilla. That might just be the mouth guard, but you know, it's interesting. Like these genetic specimens just have very strong facial structures, and it could be partially genetics. Look at this man, bro. This was the GOAT, bro. He really was. But very strong cheekbones, very masculine features, and very forward grown faces, I think, have a large impact on you know, your face.
Let's answer this holistic health question that this person asked.
Okay. I feel like since I've been mewing, my sinuses are more stuffy than usual. Is that possible or just a coincidence?
Yeah. So here are my thoughts about this. I don't. It is definitely possible that it's connected. One thing that I've been thinking about with a lot of these people that start mewing is that, especially the people that hard mew, that like really are squeezing their face a lot and their tongue. You know, I was talking about the how my tongue grows a lot when I play a lot of saxophone, and that is obviously going to create less airway volume. You know, in the same way that if you're, because a lot of these people that are doing this hard mewing, like they get really into it and they just get really obsessed with it, and they're just like, this is gonna change my life, so I need to do it as hard as I can, you know. And I
Right.
really think that if you have a susceptibility to sleep apnea or if you already have sleep apnea or you're susceptible to it and your sutures are already closed, you're only going to make your breathing worse, in my opinion, if you're hard mewing all the time, like as
You don't
much as
think
you
that could
can.
have an effect on like the soft tissue at all?
I think, well, no, but the soft tissue has muscles in it and it's going to grow. It's going to expand. It's going to have a very minor effect in terms of actually advancing your airway if you have anything close to sleep apnea.
Right.
You know, and it's possible there could be more congestion, but I mean, there are muscles on the inside of here, so you might be strengthening those, but I do think that it's like the muscles at the back of your throat and your tongue.
Right.
That I think that some like occasional pulling, like the thumb pulling, is probably a better way to go than just like really hard mewing all the time.
Right.
If you already, like, because you're really not, it's hard to change like the relationship of your jaws unless your sutures are at least a little bit soft.
Right.
But
Here's another picture or another
that is
one.
a weird photo.
Bruh.
He looks
Look at
weird as
this.
fuck.
Yeah, he does. He actually had his wisdom tooth removed. I don't know if Jake did. But Jake has a more forward maxilla than Logan. But I remember Logan getting his wisdom teeth removed. That was like a big video. But if you notice, he kind of has like a slightly open bite. I think he did actually have braces. I know Jake had braces, but Logan's face is so like, and especially in this area here, it's just very back, and it's very like prominent. At least like from what I noticed, they're still like fucking jacked, bro. Like they're still like absolute beasts. I'm not gonna lie, they did wrestle, but if you notice, like their faces are just kind of like underdeveloped in a way. And I think they're developed, but they had to have at least had like extractions. And like look at Logan's like cheekbones. Like look how flat this area here. And look how like recessed his maxilla is compared to like let's say Jake's.
The airway.
Like Jake's face is a bit more like forward, especially here. They kind of both have this like these top front teeth kind of up. So they must have definitely both had a retractive orthodontics done to them, but they also both have receding hairlines, so that could also they could have like airway problems and in combination of being predisposed to DHT and genetically just whatever. But I don't know. I think like Jake compared to Logan, like the reason why, like look how like in all of this is, like it looks like hollow, like specifically like here down, like
Yeah,
that's just like
there's not much like volume. It's just like
yeah,
this instead of like out.
exactly. Like he gets gassed out pretty easily too. Like I think that's just like extremely interesting. Like I couldn't imagine like people finding out about all of this information about like retractive elastics, extractions, how this affects not only your face but your airway, your cognitive ability. And like if you guys have noticed, like Logan has made some pretty fucking poor decisions, bro. Like really poor decisions. So like how does that affect you? Maybe just as a person, but like as somebody making decisions for your life. Like how does that might determine how you make, stupid decisions, almost like dementia, bro. Like you don't even like realize you're doing it because of how like sleep deprived you are. Your brain is deteriorating. It's almost like a form of like CTE, I think, or like early onset dementia. Like you don't really, I mean, of course, like they're in the primes of their life, but they're operating on typically people with like OSA or UARS are very like short and kind of mean. And if you notice, like there was one interview Logan did, or like on his podcast, Logan gets mad at friend for being a Christian, like this type of shit. Like you're typically less open-minded. Like I'm serious. Like this guy's a fucking asshole, bro. I'm not gonna lie, but like you're
Yeah, I've
less
not encountered him,
open-minded.
but
You're less open-minded. You have less patience. You're sleep deprived. You're annoyed. You typically have like this God complex. Like I think it's all like correlated, bro. Like I think there's just like a lot that has to go on with sleep apnea, UARS, and your behavior. Like
yeah.
I think it's all really like connected when it comes to that. But oh man, we got 30 people in here, guys. What's up, y'all?
Yeah.
Dang, I guess they're liking the website going on. But if there's anybody you guys want to like look at like faces and if we can kind of guess and see if they've had extractions or retraction. I know Zendaya actually had her wisdom teeth removed. And that's actually really sad. I think she got them done like 2022 or 21 maybe. But like I'm interested to see how like her face kind of changes over a period of time, because like 2019 I think. But yeah, like here, let's look at this. Zendaya 2018. Let's look at her facial structure. Let's see. Let's try to get a good one. Look how strong her chin is, wide her cheekbones are, forward her look how strong her brow bone is. Her hairline is very strong. She has a very strong face. She's also like what, maybe 19, 20 in this. I think she was born in like 98. Okay, so she's probably like 20 there, probably like, whatever. But let's look at 2023. Look at her face now. Interesting. Her cheekbones are a little bit recessed, I would say.
Is that after the surgery?
Yeah, this is 2023.
What did she do?
She got her wisdom teeth removed.
Oh.
So
How old is
she's probably 23 or 24 in here. Here, let's see. Zendaya age. 26. Yeah, she was born in 1996. So she got her wisdom teeth out when she was 22. So let's go back. So yeah, like her face has definitely changed. Look how like smaller her mandible is, and how kind of like her I guess that's an earlier picture, but like I don't know. I think like
yeah, well, it makes sense. Like if I know that I think it's pretty documented that there's bone loss after those are removed, right?
Yeah, absolutely. But so they wouldn't know.
No, I know that, but I'm just saying that like if those bottom teeth slightly move backwards, it makes sense that they're going to pull the maxilla slightly backwards through the top teeth.
Absolutely.
The back molars.
Absolutely. So yeah, like that's one person I'm interested to see like how her face is going to change. Like, bro, like look specifically in this region. So like the right and left side of her. Yeah, the eye support. And
that's definitely what I experienced for sure.
And how her like mandible is like shorter. You see how it's like kind of, and she has like creases. And of course, she's aging, but at the same time, her hairline isn't as strong. It's kind of coming up around here. I feel so bad. She's so beautiful, but we're just like analyzing these people. Like I know Tom Holland had his done, but like here's a good one. Like 2023. Look how short her mandible is compared to. I wish I could like share my whole screen, but like 2019. How much stronger her chin was. See how much larger
Yeah, it does
her
look
chin
larger.
was. That's at least half. You know what I mean? Like that is absolutely insane. She still has this support. Somebody said look up Justin Gaethje. But like this is one person I saw and I was like, holy shit. And if you were to like tell anybody about this, they would look at you like you're crazy. Like, what?
We need the X-rays. We need the X-rays.
Yeah. Where are the X-rays, Zendaya? Gaethje. Jesus, I don't know how to spell. Wow, look at my spelling, guys. Justin Gaethje. He just has I think he's just been getting beat the fuck up since he was a kid because that motherfucker's face is asymmetrical as fuck. Yeah, his nose is broken. He talks very nasally. This is somebody that I would recommend to get MSc or some sort of like septum.
Yeah, it's weird that a lot of these people like it doesn't seem like they approach the airway. Like it just seems like they approach the airway from a very classical perspective. Oh my god.
Yo. Oh shoot, hold on. Bruh. Look at this man, bro. Look at this man. Oh my god, just they are really nerds, bro. I'm not gonna lie, but this man is jacked. He's a beast. I mean, here I am calling him a nerd, but he fucking fought Khabib. Like, look at the difference. Forward head posture, compared to Khabib's. Look how wide this man's cheekbones are. I mean, he cuts more weight than him, but like, just his nose is like, I don't know. It's just so interesting. There's a lot of cartilage buildup. Wow. His brow bones are stronger. His zygomatic bones are stronger. His mid face is out more. Justin's is kind of like collapsed in a little bit. They definitely have big chins, big mandibles. I don't think he's had any sort of like extractions, but he definitely mouth breathes. I think he did have braces at one. I don't think he had braces at one point or at any point. But he definitely mouth breathes because of how bad his nose is fucked up. Like he has broken his nose however many times, and he kind of talks like this if you ever listen to him. So it's kind of hard to like really you can I guess attribute that to like here's a good one. Like you can kind of see his cheekbones are a bit flat. He has a very strong chin, very strong cheekbones. There's a reason why he's top 5. It's not like I think he has a strong chin. I think he got like beat up by Charles Oliveira. I don't know if they fought or not, or actually Michael Chandler beat his ass. I'm pretty sure. But yeah, bro, like these fighters, man, like if you really take a second to look at like their jaw structure and how their faces are developed, like you can really start to pay attention to how this could change like the outcomes of their fights, especially if they are underdeveloped. Does anybody have any more people they want me to look up? Analyze Tommy Fury, who just beat Jake Paul. Okay, Big Ed's face. Could you call me out or tell me any like the chat what they're saying so I can just like look it up? Big Ed. We'll start with Big Ed and then we'll go to Tommy Fury. Big Ed. I don't even know who the fuck Big Ed is. Big Ed. Oh shit, my nose is bleeding. That's crazy.
You're
Big
muting
Ed.
too hard.
Oh, I've seen this dude, bro. I have seen this guy. Motherfucking KFC looking at. God damn it. No chin head, motherfucker. God damn it. Whoa, wait a second. That's what he used to look like. Yo. Damn, my nose is bleeding. I started talking like Justin Gaethje and I started talking shit and now the universe is getting mad at me. Okay, so this is what he used to look like, I guess. Wow, I wonder if he's had any sort of like extractions or anything. Yo, look at this shit, bro.
I mean, he gained a lot of weight. So.
Yo, and he probably just has really bad posture and
I think it's just the weight, honestly.
Bro, what? You think this is the weight?
I mean, clearly all of his health is deteriorating, but
that is very true. Like, I mean, look at his. Don't know. Wow, analyze this really quick. I'm gonna go.
Certainly possible. I have no idea.
Try to clean up this blood off my carpet really quick. I'll be right back.
Yeah. This guy. Oh yeah. This I can't put these in put the comments up, but Will was saying that lots of people report back with the throat responding to the tongue pressure in the back. I do think that if you feel that, then definitely keep doing it. And you probably don't have the same issue. You probably don't have the same issue that a holistic health person was having that I also have. It may, because holistic health's maxilla is very narrow, as they were saying, and so it maybe if you can't change like this without the sutures being opened, maybe there's something where like if you're putting a lot of force into that system, more of the movement will come forward, and the teeth will come forward instead of the jaw moving outwards, and then you have an elongated narrowing of the nasal airway. So maybe that's why your nasal airway would be smaller. Just an idea. Wannabe truth, your ortho's wrong for sure. They definitely do. You're not gonna notice it in everyone's face, but it's definitely impacts you. Yeah, not too narrow.
Back in this bitch. I'm back in this bitch. I'm back in this bitch. Hello.
Hello.
Dang. Bro, that dude is so ugly. Damn. Why he look like that, bro? What the fuck, bro? I can't. This man said, big head. Yo! Are you serious? Yo, he's got to be rich, bro. Big Ed net worth, bro. Hold up, net worth. It's got to be like at least a couple million, bro. At least. Yeah, 800K. Yeah, that's why. Yeah, that makes sense. I mean, he looks decent here, but like, bro, that man, bro, mouth breather, obviously, bro. Mouth breather. I mean, man, look like Danny DeVito's grandpa, bro. What the hell? Yo, who else? What they say? Tyson Fury? Hold up. Just chew like our ancestor. Oh shit, hold up. Oh dang it. Oh freaking dang it. Hold up a second. His neck is literally gone on God. Yeah. I feel like puberty messed me up, not because of braces and elastics. I used to be 10 out of 10. Okay, we'll do Tyson Fury's face. Oh wait, hold on. Richard Chamberlain had premolar extractions. Can you assess his face? Richard Chamberlain. I don't know who the fuck that is. I'm not even gonna lie to you, bro. Richard Chamberlain. Hello?
Yeah.
Hey, I'm streaming right now. Can I call you back? Bye. My bad. Damn, a lot of these old motherfuckers really had like extractions, bro. Like crazy, bro. Like really crazy. Like that ass. All right. Let's see. Young. Okay. All right. I guess we'll go like Chad, bro. Okay, let's all right, decent forward growth, maybe. I don't know. Okay, and then is that him, bro? Damn. Okay, look how
Pretty good.
okay.
It's pretty
Yeah,
good for that age.
He does. Look how like strong his cheekbones are. I mean, it looks like he has like some sort of like braces or like retractive, maybe. I don't know, because of the wrinkles here. But he has a very large mouth here. His teeth are forward. It looks like he has all of his teeth. 1, 2. I don't know. Is that one right there? I can't really tell. Yeah, like back in there.
I mean, as much as you could tell, yeah.
1, 2, 3. So
Looks
maybe,
like
yeah. He has very strong cheeks. Even here, man. Look. Oh, I don't know. I can't really tell. All right, let's look at like after he gets his teeth out. Or I mean, who is this guy, bro? Why does he look so like familiar? Yeah. Yeah. See how like recessed his brow bone is, and how like in his this part of his face is. I don't know. And how okay, so you see how his teeth are more up now? He must have had like something shaved. Like these front teeth are more like up compared to how they were down in this other picture. Like look how large his mouth is in this. Like his teeth are so large, and how his teeth are like down compared to like with his canines. And then you go back to like that one picture I was just on. Like, yeah, he's I don't know. I think he has like a very developed face. I wouldn't say extractions really fucked him up too bad, but you can see how his front teeth are
Yeah,
like
I mean
really
that's
back
it's
now.
kind of hard to tell like with how old he is and not
Yeah. Oh, that
because
look.
all your airway and your jaws are like they're going to recess if you get older in general. So, but his face structure still looks pretty decent at that age.
Okay, I guess we'll do Tommy Fury now. Tommy.
We should go. You mentioned the at some point like the low basically low grade dementia or low grade uh, brain damage,
Right.
and we should talk about that a little bit, especially
Absolutely.
connected to the those antihistamine.
Of course. Yeah, I think UARS and like that long term like asphyxiation. I don't know if I'm saying that shit right, but definitely atrophy to the brain and like what parts of the brain are affected when you have sleep apnea or UARS, and how that affects your cognitive ability, and especially with like those antihistamines, because I saw somebody mention that in the comments. That was pretty interesting. But Tommy Fury's face, god damn, look how wide he is, bro. Jeez, he is wide. That's no homo. That's us. He has a pretty developed face. He might have had extractions. I don't know. I can't really tell, but he has a very strong face. Like, okay, like look at this. See how forward this part of his face is compared to like Jake's. See how he looks like a motherfucking gremlin or something, bro. And he has like no top lip. Like
Mhm.
he's definitely had like some sort of like braces or some shit. But yeah, I guess Tommy is like, well, let's see. He might have had some sort of treatment done to him. Can't really tell though. Mm, yeah, I don't know. Okay, here's a good one. Here's a good one. Here's a good one. God dang. Look how forward his maxilla is, bro. Look at from here all the way to here. And like how his lip comes out forward, it's more full. His nose is stronger, his brow bone is much stronger. He really has those hunter eyes. His zygomatic bones are pretty wide. Now compared to Jake's, oopsies. Compared to Jake's, he has a very big dip here. His chin comes out more than his maxilla. Um, and even like back here, you can kind of see like there's like a crease compared to here. There's like a line, and his jaw is forward. But back here, it's like a crease. It might just be a shadow, but what I found is that people who've had like retraction when their mandible comes back, this skin is kind of like compressed, so there's like a little crease along the ear, even like along the backside of the ear. But yeah, his maxilla and his nose even is just so much shorter. I think when you retract the maxilla, it affects the nasal bone up here too, and it kind of shortens it, and that can kind of affect like the shape of the head and the brow bone as well. I think it like really dissolves this bone. Like look how much shorter and smaller his nose, Jake's nose, is compared to Tommy's, and how much his eyes are kind of like sunken in and his cheeks are kind of sunken in. They both have pretty wide faces, but I would say Tommy's face is definitely more developed and forward compared to Jake's, who has probably had extractions and or braces. But we can get into what you wanted to talk about. So let me stop.
Hey, tell that to this nose.
Oh, you got a dang son, my guy. Who is Jack Harlow? Jack Harlow is a rapper. He's an artist. That boy is vanilla. Yeah. Also, okay, this is a good question, Mrs. Lori Thomas. Older generations didn't have the same access to nutrition and dental care as a result. Um,
Lost.
crooked lost teeth. That is very true. But at the same time, they also didn't have bottles. So I would argue that older generations actually had more developed faces until orthodontics was created. So I think up until the second industrial revolution, people's faces were much more developed. And yes, teeth would fall out more and they would become more, I guess, before like toothpaste and stuff and better hygiene was invented. But I think back then there was stronger cheekbones, better airways, and larger oral volumes.
Yeah, I think the nutrition, honestly, in some ways is worse overall. Like there's certainly more access to cheap food and a
Processed.
lot of calories, but it's not like a high nutrient density food in the way that it was for the vast majority of people are not eating the way that we used to before dental care.
The goal of braces is to straighten teeth. It's much easier to do so by pulling teeth together and in. Just because it's easier doesn't mean it's the right way to go about it. Specifically, when there's rising information and studies are proving that extracting teeth and retracting them inwards is shrinking the nasopharyngeal and oropharyngeal airways. That's actually very harmful. So just because it's easy doesn't mean you should.
No,
And
listen, this guy, like these sort of this sort of like view that orthodontists have, and that the teeth are just floating in the head magically. Like this is so stupid. Like it's you're not just straight. These teeth aren't bent. They're not. You can't straighten the teeth. Like it's just you don't like how they look in your maxilla and your mandible. You don't like the skeletal relationship, so you're trying to force the skeletal relationship to change by moving the teeth and dissolving the bone. Like,
yep.
It just
And I think when people go to dental school or orthodontic school, they're kind of under this, they get taught that exact same thing, that the teeth are just kind of floating and that, you're removing teeth. They fixate on the teeth rather than fixating on the skull as a whole, and questioning the influence the teeth have on the rest of the skull and the harmony of the skull. So like, that's a very like linear way of thinking, and it's actually very terrible. And that's what led us to the current state of orthodontics now, is that linear teeth only way of thinking of, just straighten the teeth. You don't care about anything else. Pull the teeth, straighten the teeth, get the teeth straight, and you're good. And it's like, it'll make you healthier, it'll give you a healthier smile, it'll give you this, it'll give you that. But that's just not true. Like science is showing now, as time progresses, it's showing that is actually not true. And the fact that orthodontists and orthodontics as a whole is just rejecting that and not even paying attention to this this new research is absolutely horrendous. And you should actually seriously question whether your orthodontist actually knows what it is they're trying to do without actually harming you.
Yeah.
So, what the fuck? we beating up on people. Wow.
Can you make your own?
Yeah. Yes, I would suggest you. Just kidding. My dad had 14 teeth pulled, and he is still severely crowded. That's tough.
What? How do you have 14 pulled?
What the fuck? Does he have implants?
That's a lot of teeth. I don't know.
Excuse me. My top wisdom teeth are full of cavities, and I'm set to have them removed this week. I'm 28. Is this a bad idea? What is the alternative?
Are they erupted? That's the question.
I'm assuming they are, if they have cavities, or slightly erupted, maybe.
I mean, I don't know that much about this, but like, I don't think if it's fully erupted and it's not causing you pain, I mean, I don't think the cavities alone are a reason to extract those. Because I don't think that.
Yeah, I don't know. I would try. I would just get like fillings, bro. Just get fillings and.
No, don't do that.
No.
So
you're saying extract and then get implants?
No, well, I mean, I'm not saying extract. I'm just saying that like you should try to fix if they're fully erupted.
Oh, they are fully erupted.
Yeah. So if as long as you work on, I don't know what your diet's like, but work on fixing your diet, and you know, you can definitely recalcify to an extent. Check out what is it? Sodium calcium, forget which, sodium calcium triphosphate, or they're one of those toothpastes. It's way better than fluoride, in our fluoride conversation. But yeah, I would not. But the filling is really a really dumb idea. Um, in general, like for cavities in general, like one, because you can most of the time reverse the cavities if they're not severe enough. Um, but two, like you're taking like a porous surface and object, and
Digging a hole.
creating a bunch of holes in it and inserting it with this extremely hard non-porous substance, and then just letting it be. But you know around the ring, like a ring around that filling is just going to be weaker, and it's going to be full of holes, and you're going to still have the same. It's not changing the issue.
Mm.
Um, plus it can lead to your teeth cracking. Like,
Holy.
because if you think about it, like if you have a rock or something, you have a wedge going through it. Eventually, like most of them are like sort of this shaped, roughly, like they're sort of a cavitation shape, or slightly V'd. And so if you're biting through those, especially your molars, that's like you can see that a lot in extraction cases with like root canals and fillings, where the root will, like the entire tooth down to the root will be cracked. Yeah, definitely look at the personally. So okay, we were talking about this in the chat a little bit, or in the Discord, but about the fluoride controversy or whatever, and toothpaste. But my approach, honestly, like I don't like fluoride is a dumb way of calcifying your teeth. Whatever people think about it otherwise, like it's not a very powerful calcifier, and I don't think that you definitely don't need to have it in your water. That's a stupid way, because it's contacting your teeth for 2 seconds. But in your toothpaste, I think it's not very smart because it's not very strong, and I don't. So I personally would use. I like to use ones that doesn't have. I like to have ones that don't have fluoride, that are just basically trying to clean your teeth, right? And then occasionally use it's called Novamin, the ingredient, but I think it's like sodium calcium triphosphate or something. Let me look it up. It's basically they use this mineralizer in the US in dentist's office. So if you go to get a deep cleaning and a bleach or a teeth whitening, they'll put this on there to let it sit on the teeth for a while. And it's the strongest recalcifying agent that exists to the public. Calcium sodium phosphosilicate, yeah. So Novamin, I don't like all the other ingredients in these toothpastes, but I think using that once or twice a week, combined with really good oral hygiene. I've heard also that for some people xylitol gum can be helpful with that. I haven't tried that, but I would really try to see if you could fix those cavities. What is your diet like? If whoever's asking this question, because that mouth breathing also won't help with will make that worse. But I'm just not a fan of introducing the calcifying stuff to the body every day over and over. Because there's some evidence about the pituitary. That's the main thing people bring up with fluoride is pituitary like calcification from fluoride, and there's some evidence that happens, but like these things are gonna calcify a lot of different tissues, not just if there's evidence for that, they're not gonna just act on one tissue. So I don't think it's beneficial to just have a bunch of fluoride or the Novamin floating around in your mouth like twice a day, every day. Like I would much rather do it like, get your teeth whitened, get this, if you're doing that, get them as clean as you possibly can and do a targeted recalcification. To me, that's a better approach.
Yeah.
I like that toothpaste a lot. You can't really get it in the US, but you can order it.
I want to there's a video by this man who is an orthodontist who basically says extractions can't cause any sort of flattening of the face. I was wondering if you wanted to react to that with me really quick.
Sure.
All right, let's if you guys would be interested in that as well. Shift this. Share screen. All right, here we go.
This guy.
Bro, this motherfucker. As the myth-busting orthodontist, I'll slap the shit out you, bro.
As the myth-busting orthodontist, I get told by dentist after dentist, you can't extract teeth because you're going to destroy the patient's profile.
Shut your bitch ass up.
And then I ask them, why do you say that? And they tell me that they've been taught that by other people, but in particular, the classic 60 Minutes episode with Derek Mahoney and John Mew, which was probably about 15 years ago. And John Mew showed two patients. They were a set of twin girls, and he treated one of them with a functional appliance because they both had a...
Pause. Do these look like twin girls? Are these girls?
Severe class 2 skeletal problem. So John Mew treated one girl with a functional appliance without any extractions and brought the mandible forward. For some unknown reason, the other girl went off to another orthodontist who decided to treat them with 4 premolar extractions. And that patient ended up with the teeth being retracted, the lips being very flat, a very concave profile. So with one set of twins, the end result of this was you can't extract teeth because if you do so, you're going to ruin the facial profile.
Yes.
Well, I can show you numerous patients, probably hundreds of patients, where we've actually extracted teeth and there is no flattening of the profile.
I'm sorry. What is he?
But that doesn't.
What is he saying?
That's like a correlation thing. It's just.
Can we just look at this man's?
So why would that be?
Why is he manhandling this girl, bro?
There is no flattening of the profile. So why would that be? Well, the reason is...
Are we really going to listen to this dude talk about extractions, bro? Are we really going to listen to this man talk about extractions?
I get it's just like annoying that there's so little nuance because like it's not going to cause flattening in every case, but it's like it absolutely I feel like there's too much evidence.
Like, bro, just look at
for some people.
Patient that John Mew talked about, where it was a class 2 and they took out 4 premolar teeth, was incorrect extractions.
Okay, so what? I'm sorry. Incorrect extractions.
So by that I mean a patient who's a class 2 patient with a severe overjet, the last thing you want to do is extract anything in the lower arch. Because
I want to extract in the upper arch. Man, fuck you, bro.
As soon as you extract anything in the lower arch, the lower teeth are going to move back, which means I've now...
Wait, pause. Did you hear what he just said? If you extract teeth, the teeth move back.
Got to move the upper teeth back even further. So my principle is you never, ever extract teeth in the lower arch in a class 2 patient. Yes, you may need to extract in the upper arch.
For real.
And I can show you hundreds of patients where we've extracted only teeth in the upper arch in a class 2 patient, and there is no detrimental change to that patient's facial profile. So it's a total myth. A myth created by one.
I mean, it's just, I don't know. It's so annoying. But what was I gonna say? I guess I think also some of these people measure the changes over the course of a year or two follow up. But I do think that there's things that can happen 5-10 years that can continue to change once you have that done. I don't think that it's just you have it done and after a year, that's the result you have.
Right.
Because your airway is going to close as you get older anyway. So if you make it smaller and then, but you're doing it at a young age, so you're not going to notice the effects of that until you're older.
Yeah, no, literally, I don't think what they're failing to understand is the long-term effects this will have on your face or airway. How does that affect the alveolar bone dissolves by 50% within the first year, 30% within the first 3 months, and then 1% annually after that. So let's say 10 years down the line, 50% the first year, and then 10 years after that, that's 60% of your alveolar bone has been dissolved because of extractions. So I don't understand why this is even a debate. It's almost egotistically they can't confirm this as a possible problem within orthodontics because it directly counters their argument of why retraction and extraction should happen in the first place. So they're just pieces of shit who can't admit that they're wrong.
As the myth-busting orthodontist, I hear time and time again that every patient should be treated without the removal of teeth. In other words, they should be treated with a non-extraction approach. And what do I say about that? Absolute garbage.
What? Are you serious, bro? All right, let's take a second and look at. Nah, you know what? I don't want to be mean, but goddamn, bro, are you serious? People really think like this. And when was this posted? September 14th, 2021, bro. 2021. This man literally stands on that. He literally truly believes that in other words, people shouldn't have their teeth extracted.
And what do I say about that? Absolute garbage.
Bro, fuck this. Garbage. Garbage.
This is
this is crazy, bro.
By patient basis. So let's understand what happens when you treat a crowded case without resorting to dental extractions. And most of our patients, I agree, should be treated.
Oh my God, look at that.
Bruh.
And most of
Oh my God. So you're telling me an MSE wouldn't fix this?
Yeah, that's absurd. Well, it's also weird. It's also strange because I mean, it looks like that person has an open bite,
Yeah.
And so, but MSE was originally to fix the crossbite, I believe, right?
Yeah.
I don't know. It doesn't make sense. But.
One question somebody had was, so should I ignore my dentist, keep my wisdoms, and try to heal the cavities with a clean? Honestly, yes, absolutely. Yeah, I would try this.
That would be my approach. Yeah.
Wow.
Because you can always get them out. If they really have a fundamental issue, you get them out, and that's it. But,
bro,
I would not do that. Yeah.
Okay, so sorry to interrupt you, but otherwise, why hasn't anybody sued them? Well, the reason why nobody has sued them is because sleep apnea is you wouldn't even know you had it until.
No, the real reason is they what you sign when you get the treatment.
Exactly, it's a blanket cause. Yeah, so it says in there when you sign the contract, I understand every negative, or I understand all the consequences, but it doesn't strictly say in the contract what the consequences are. So it doesn't even tell you what it is that the problem is. What?
No, they go. We're not financially responsible for any unknown or unintended consequences of this treatment.
And that's insane, bro. That's actually insane. So that's where the misinformation is. What's the truth? Do braces and elastics negatively affect the face? Absolutely, 100%. I can pull up a research study right now and prove it to you.
I need the truth. Oh my God.
Bro, my guy said, I need the truth. I need the truth.
What is the truth?
How though? Because retracting the maxilla brings the it actually constricts the nasopharynx, which is your nasal cavity, and brings the mandible back, because if you bring the top teeth backwards, you have to bring the bottom teeth backwards, and therefore the mandible, so your jaw has to compensate for where the top teeth are by coming backwards. That brings the tongue into the airway. So not only are you restricting the nasopharynx, but you're also constricting the oropharyngeal airway. So you're literally getting fucked in both airways just by retracting the maxilla.
His response. Buying a rope.
Yo, this man's done, bro. Nah, don't do it, man. Buy a rope, attach it to your door, and protract your maxilla.
Yeah, there you go.
Of course, Mr. Chakra, my guy. They will pull your yep, exactly. I don't know who Bailey is, but bring up your before and after X-rays proves the point perfectly. So I guess in a conversation JawHacks had with some random guy, Bailey. I have no idea who that is. That's totally not me. Totally not me. I don't know who that is. Here, hold on. I guess we'll pull it up really quick. My X-rays in that video, man. No. Here they are. Well, wait here. Where are my X-rays at? I guess. Can you see? Or hold on.
Yeah, I can
see this one. Okay. So this guy here, man, I hate looking at pictures of this kid. I don't know who this kid is. So yeah, like especially here, like look how forward the maxilla in mandible is, compared to here, and then compared to here, and compared to here. It's just so funny how the lighting just got worse and worse as they fucked my face up. That pissed me off. Where are my X-rays? I want to see my X-rays because that's what he was referring to. Is it here? Hold on. Do y'all know where it is, or where I show the X-rays? I actually have no idea. I think it might have been earlier in here.
Huh?
Sorry, y'all. Uno momento. I think it's like right after here, actually. Or not. Anyways.
Yeah, your face definitely looks different from that since that video.
Oh yeah, for sure. Like even just like the cheekbones here, and
yeah, and the nose.
Yeah, my nose is like crooked, and
like the eye support.
Wild, bro, wild. I'm gonna see the X-rays, man. X-rays. Where you at, X-rays? Can you see? All right, this is the last time I'll look for it, and if I can't find it, then we'll just move back. Well, here they are right there. I don't know if you can see them. Probably not. God damn it. So, here's my blight. But basically,
I'm so sorry, y'all. I'm so sorry.
From February to no reason. Really?
Why don't you mute that?
If you look close enough. Does anyone know? 117. Thank you so much. You are goated. 1 hour 17. I'm bugging. I knew it was in here somewhere. Oh, okay, here we go. Damn, that took me a lot longer than I should have. Sorry. So anyways, as you can tell here, just like if we highlight, this is before, right? Look at my posture. And this image actually is tilted to the right. To just because I wanted to get like, I don't know, you can even tell like here. So like this is honestly counter clockwise. This image right here should be rotated back maybe 5 degrees. But just look in here. Like if any of you in this chat want to get extractions and or retraction, I want you to take a long, hard look at both of these X-rays. I had an image somewhere
that's crazy.
where I highlighted like circles like here and here, but like just look at my airway. Look at the position of the
it seems like the length of your nasal sinus is longer. Like it's forward. It's like, you know what I mean? Like it almost like it like shifted.
In which one?
This like forwards. Like it may I mean in the second one.
Here.
Yeah, like from the I can't like show you where I'm pointing, but that whole black square really that whole black square in the before photo and then the after. Look how much longer it is. Like
this
because and maybe this is what we were talking about with the someone asked about the hard mewing and like their nasal breathing being worse. Like it looks like when the face is elongated downwards, and it might be that the actual nasal the sinus becomes like lengthened forwards and narrower because of that.
Right.
Instead of being like shorter but wider.
This image also might be like stretched slightly. It's not like when I took a picture of like a computer screen with this one, the guy who took the X-ray, so it might be a little off. But like just like another thing is like look at the position of this nasal bone compared to this one.
Well, your chin, I mean, it's very clear, yeah.
Like look at my chin, bro.
Definitely, and the
like this is crazy, bro. Like really, like even just here, like all right here, like look at everything that was lost compared to this. Like look at this, and then
how hard that bone is.
Look at my front lip, and then look at this one. So people say like, oh, the lip comes back. Well, typically sometimes it doesn't. You know,
look. This is exactly the mid face support you were talking about in the before picture. Like if you look at right behind the nose, the thickness of this bone right there.
Yep.
And how it's cloudy and thin after.
Like here, right here.
Yeah.
Yep.
And obviously you have less mid face support because of that.
And like look how much shorter like my roots are, specifically like my front teeth. They could just be like back, but like look how much longer these teeth were, my front incisors. Look at that. I did have a deep bite, slight over. Like, look how little that overjet is.
Yeah,
that should not require 2.5 years of retraction. Yeah, absolutely not. Absolutely not. And look at the height of my mandible. Look how much taller it is in this one. Look how much more forward and kind of like stronger my chin is compared to this. I have this little the dip here. Like hypothetically, if this was me, you know, this isn't me, but the mandible is just so much larger. And I was 17. I wasn't even done growing, bro. I wasn't even done growing. That's the crazy part. Like I wasn't like, that is so annoying, bro. That is so annoying. Like this really like aggravates me beyond comprehension. And even like my posture, look how much forward my neck is and up my head is. Wow. It's just sad, honestly. Like I honestly looked at like this brow bone too. Like, I mean, I was 19. Actually, I was 20 in this picture. Yeah, I was 20 in this picture, but I was 17 and then 20. So like as you grow, look how straight my neck is. Okay. Look how large my mandible is, how forward my maxilla is. Even my brow bone was starting to develop even more. So like how on earth did this get stunted like this? And what are you going to tell me? Oh, well, it's just your genetics. Like that's what an orthodontist is going to say. Like,
well, you're the what is it? This bone, the nasal, what is it called? The nasal, fucking, what the hell is this part called? The nasal bridge? Is that what it's called?
Yeah.
That seems like in the second photo, it's like pointing forwards more and out.
Yep.
A little bit.
Yeah. And, bro, it's just I don't even want to look at these anymore, bro. This shit's pissing me off. Hold on, see if we can go back. I wonder if we can finish this. What happens if you?
Oh God!
Every patient should be treated without the removal of teeth. In other words, they should be treated with a non-extraction approach. And what do I say about that? Absolute garbage.
Bro, I want to slap the fucking glasses off this dude's face, bro. I'm not even joking, bro. I will fucking wax this man's chest hair in his sleep with his mother's testicles.
We have to understand the diagnosis, expand the arch to get the room. We expand the arch, make that arch wider. But what's interesting is for every 4 millimeters of expansion, we only get 1 extra millimeter of arch length. So in other words, if I had 8 millimeters of crowding, I would need 32 millimeters over 3 centimeters of expansion.
Dude, what are you talking about, bro?
To get the room for the teeth to fit in without those front teeth coming forwards.
Oh, honestly, I don't even know what to say to this man. I think he's misunderstood about MSE because for every 4 turns, or excuse me, every 6 turns, or no, is it 4 or 6? turns, it's 1 millimeter of expansion. So I'm not really understanding what the fuck he's talking about. I think he has some sort of like.
No, I think he's saying that in terms of the actual full, like the if you were to take the arch and flatten it and measure that length, he's saying that for every centimeter that you expand, I think centimeter he said, but every centimeter you expand, you only get a millimeter added to the length of the arch for it to fit crowded teeth.
Right.
That's what he's saying. Which I don't know if it's true, but
I'm 17 months. And I'm 17 months. I've been holding correct tongue posture for a while. Will I still see soft tissue changes? Yes. Jawley, do teeth need to connect when mewing, or is it okay for a slight gap? They don't need to connect, but I honestly think
I think they should.
They should, exactly. Just to like stimulate like biting force. Like I think there's absolutely nothing wrong with that. If your concern is bruxism, like
if this person has like a few teeth that aren't touching, but the rest are touching, then that is obviously fine. But if none of your teeth are touching, then there's no real point.
Agreed.
And that's why like if you don't have enough tongue space in your arch, like it's pointless to try to hard mew. It's just gonna grow your soft tissue and make your airway worse. You need to get the real issue fixed.
Wow.
This person asked the same guy asked about the myo brace. You could put that one on.
Can we consider?
Absolutely do not use that. Like it's a really bad idea to use. I had one of those at one point. It's like a really dumb way of it's like one plastic tray that has. Do I even have it? No, I don't know if I have it. It's like imagine just like a mouth guard almost that goes over both teeth, but it repositions your mandible, right, so that when your jaws are clenching when you're sleeping, it applies force to the teeth. So it's like completely indiscriminate. It doesn't address any skeletal asymmetry. Like it's a really bad idea to do that.
Wow.
Like I tried it for one night and like just because I was curious, but it's not a good idea. Like it will give you an open bite, and maybe if you're super young, but like definitely do not use that.
Do you recommend jaw surgery for people above the age of 25? I guess, but like now with piezo being in the mix, like there's unless you really just want to completely reconstruct your face and you don't feel like going through MSC treatment, bro, I agree that like there's so many nuances, but like you really have to look at your specific case and make a decision, because if you have extremely severe sleep apnea, in a lot of ways you might be better off getting that jaw surgery. But if you have zero issues with your aesthetics or your breathing, it does not make sense to go with the jaw surgery. But I think in my case, the way I think about it is that I don't want in double jaw surgery, or MMA at least, they're cutting the entire maxilla off and sliding it forward and reattaching it. And I personally, there are different segmental cuts that they can do in your palate. It was just really scary to me, but they like cut like in here in your bone. So they cut your maxilla into 3 pieces, but to get the horizontal growth, but you just cannot mimic all of the horizontal changes, as well as the changes in the zygomatic bone in the eyes from jaw surgery. It just won't happen, especially compared to if you did NMSE and MSDO first, which is my approach because I have pretty bad sleep apnea. So I'm trying to get the maximal horizontal growth first, and then let's readdress if sleep apnea is this person's issue, then you assess how that impacts the sleep apnea first, and then once you create a solid foundation of bone that is wider
overall, then you can move it forward later if you need to. But it really should not be a first approach.
Agreed. I think MSC is definitely something to be explored more before you even throw 40 grand on the table for jaw surgery, because it could fix the majority of your problems and actually even give you benefits in the mid face rather than leaving it up to the hands of a surgeon, because once you do it, it's one and done. You have no control. Once you do surgery, bro, it's they bring it forward. They don't change the shape of your maxilla at all. And it's done. So they're just bringing everything forward. Can you explain what piezo is? Piezotome, piezoelectric knife, is a device used to help split the suture prior to the installation of MSC. So let's say you wanted to go get MSC. You are an adult. Let's say you're 21, maybe even older, and you're a male. You're going to get piezo if you want an actual split. It will drill holes. It's almost like a buzz thing. It's a vibration. It heats up, and it will do holes into the suture of the maxilla to help loosen it up. Some people, some cases get through the nasal spine, which is like above your front teeth, which in my opinion would be extremely painful. But piezo is something, it is a tool that is used to help split the suture, and it can be used on any age, any person, and it will guarantee a split. Okay, somebody was talking about I have a tongue tie. Should I cut it? That's up to you. I wanted to get my tongue tie cut, but a frenectomy costs like $6 grand. So I don't really think it's worth it unless you have a really bad tongue tie. So yeah. And also, if you're going to get a tongue tie, a frenectomy, I suggest doing expansion first and then do the frenectomy to help maintain the expansion.
Yeah, I think that's good advice. Yeah. I just, some part of me thinks that the short tongue tie is actually helpful in keeping the tongue out of the throat when you're sleeping, especially if you mouth breathe or have sleep apnea. So I agree that doing the expansion first would make more sense, because it will keep the tongue like physically tighter and tied to the front, rather than just like really not connected and just falling backwards.
Right. How many people are actually successful expanding with MSC over the age of 25? That really depends on the orthodontist and whose hands you're in, pretty much. Dr. Lipkin actually had a 100% success rate in using MSC and piezo, and every person, every age he did. Typically he works with adults, and for patients over 25, he specifically mentions in the first interview he did with Ron that he had a 100% success rate in splitting the suture combined with piezo and MSC over the age of 25. So everybody pretty much. But now with piezo and the more practice and as time goes on, it will be more effective, and more people will get a guaranteed split. So now it's not even worried about splitting the suture. Now we're worried about asymmetry. The bad news is if you look visibly recessed, orthodontic camouflage treatment will not change that because it can only move teeth. I guess the only thing orthodontic treatment right now, the standard orthodontic treatment will do will recess you even more. So I don't even suggest you doing anything unless you want to get MSC or some sort of face mask. What progress can I expect at 22 from just mewing? Maybe some form of alveolar bone growth to a very small extent, and maybe some soft tissue change. Braces, elastics, etc. don't change the appearance of your jaws. They only provoke alveolar bone remodeling to allow your tooth to move to the proper position. I think the teeth have more. We kind of just already talked about this. The teeth have more of an influence on the shape of your maxilla and than anything, rather than just the alveolar bone. So if you reshape the alveolar bone, you're essentially reshaping the maxilla. So Dr. Lipkin says that, but why? What about in your community? Any failure with piezo? It's pretty hard to fuck up with piezo, to be honest. It really gets the job.
Well, before they had the piezo, they were doing the cortical punctures. or at least people are definitely still doing that. I think that's what Ron had done.
Yeah.
But I know that Yousefian, my doctor, does not use piezo, especially on the bottom. Well, he doesn't use it at all, but he used it on the bottom, and in his interview, he said that it led to some necrosis. But I think Lipkin, it makes sense that Lipkin says that, there's less blood vessels in the top suture. But anyway, like, you don't need the piezo, but I think that over 25, if you're a male, it's more common that it's more likely that you're gonna need either a cortical puncture or a piezo. Like, you're not just, it's 25 is, especially if you have any asymmetries, but
yeah, I mean, what about in your community? Any failures with piezo? I mean, I asked Zabad what his success rate was, and he said pretty much, and not to quote him directly, but pretty much every person he does piezo on, he gets a split. So I think if an orthodontist practices MSC, okay, here's where the thing that sucks is we're so early on in MSC's lifespan that not every orthodontist who provides MSC even knows how to use it properly. Number one. Number two, they probably don't even have piezo. Number three, and number four, you're only gonna get people with MSC who really or who are good and successful and can prevent asymmetry with MSC, and that's the people with experience. So if you go to an MSC provider and you say, how many cases did you do in 2022? And they say, maybe 10, walk away. Walk away. If you didn't have at least 50 cases in a year, if you're not averaging, or the orthodontist isn't averaging at least, or hasn't done over like 100, 200, 300 cases of MSC, I wouldn't even bother unless you don't care and you don't mind about asymmetry. That may be a very ignorant statement to say from me, but I don't know. I personally wouldn't fuck around when it comes to that shit. Why is it so expensive? Because it's new and not a lot of people provide it. So if you want it done right, you're probably gonna have to spend around $10,000. I'm not sure if that's what you're asking about. Does bruxism cause tooth loss? Honestly, I'd say the opposite. Maybe increase your potential to get cavities, but like bruxism, which means you're grinding back and forth or side to side. There's actually an interview I watched with an anthropologist who looked at the teeth and the enamel and how people back in a couple hundred years ago, their enamel would wear down and then this yellow tint of the tooth would be exposed. And it was actually very normal for them to have it. So I don't know. I don't think bruxism is as bad as people think.
Yeah, it definitely depends on a lot of different factors. It's not alone. It's not going to cause that. But
Agreed.
if you got really bad oral hygiene and you're already recessed and then you're fucking clenching the shit out of your teeth constantly, probably not going to be great for your longevity of your teeth. But
absolutely.
But it is normal to, like, when you sleep, every single time that you sleep, your body is chewing, basically, like it's biting. So that's normal, but some people have to do it more than others.
Okay, somebody said my ortho is going to put a Hyrax first since my palate is narrow, and then okay, that makes sense. And then she's going to do a traditional MSC when there's enough space to fit in. My palate is 31 millimeters. Is that a good plan? I mean, honestly, yes. I mean, yeah, that is very tiny. To get the MSC in there, if they're saying get a tooth borne and then put it in, of course, as long as you're expanding the lower simultaneously, I don't see a problem with that. If you're asking, I don't know what that is. Jawley, have you reversed your ortho damages? I was gonna sneeze. No, because the alveolar bone recession that has dissolved is permanent. You can't get that bone back. At least to my knowledge, you can probably stimulate a little bit of alveolar bone to grow, but at this point in my life, no. Even with MSC and face mask, I don't think you can completely, or even jaw surgery, unless they add some sort of like bone graft. I don't think you can completely reverse the damages from orthodontics because of the brain atrophy that is irreversible. You can look up UARS and its links and low oxygen levels. and how that affects your development, how that affects your physical development, how that affects your learning ability, how that affects your cognitive ability. Because if you're saying supposed damages, I mean, I'm not sure what if you mean. I'm not sure if you saw the X-ray or not, but that's definitely not supposed. And I'm just sorry, I'm getting a little heated here, but yes, there are orthodontic damages. And if you ask any orthodontist and they deny any sort of that retraction or extraction has any negative impact on your face or airway, they're just ignorant at this point because the research is there. And if they can't acknowledge it, they're ignorant. So one thing I noticed is that once they do Shukai, I think I saw your comment. I be seeing you, bro. Thank you for joining the conversation here today. One thing I noticed is that I saw this comment. Once they do the piezo cut, it will split maybe 0.5 millimeters, very small, but some people won't expand after that. But at least TBI seems to consider that a success. I mean, I wouldn't really say it's a success if the MSC is expanding, but the suture isn't, because then you're getting screw drag or the MSC's failed. So if they really consider the split by 0.5 millimeter a success, I wouldn't really consider that a success. But maybe you need more piezo. Maybe they need to go through the nasal spine because, excuse me, from what I've seen through the nasal spine, bro, my nose keeps bleeding, bro. What the fuck? Through the nasal spine, I would say that's when you get the most amount of like success. When you are an adult and you get piezo, like Patrick, he actually got piezo through the nasal spine and the roof of his mouth, and he split he got a diastema within 3 days, and he was turning once a day. So I don't really see how that would be considered a success unless they're trying to pad their stats. Like this is fucking 2K or some shit. How do I get on this live chat? I have no idea. No, I'm just playing. I think you have to, on mobile, you have to like scroll. It's weird on YouTube. And then on desktop, it's pretty easy. I would love to contribute my knowledge on this topic. Okay. I definitely need jaw surgery, though. Does anyone know of good jaw surgeons? Dr. Courtney Chow. There you go. Bruxism is not normal. It's caused by a deep bite. I guess so. Can we use MSC at any age? I asked Dr. Zabad this exact question, and he said the youngest he's used MSC was on a 9-year-old patient. That's insane. I thought that was actually wild. Blah, 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 blah. Not above 80. Okay, I didn't know that. Because of the anxiety it gives you? Are you serious? You old ass bitch. Just die. I'm getting crowded. No, I'm just playing. I'm getting I'm getting my crowding fixed with the extractions. Is that still bad? Yes. Do not get extractions. If you have crowding, get expansion. It is worth the investment. It is worth the money. If you're already in debt because of school, take out another 15K and get MSC. I'm not even joking. It is not worth the long-term negatives of bone recession and airway problems because of extractions. Can the maxilla change at 17? Absolutely. I think the maxilla doesn't stop changing until the age. I mean, in literature, it says like 16, 17, or maybe 14, the maxilla stops growing. But can the maxilla change at 17 with an external force such as retractive elastics? Absolutely. Jawley. I have permanent braces behind my bottom teeth. Will this be a problem with mewing? Will my teeth get screwed? I don't think so. I've never had permanent braces behind. I have high racks behind my bottom teeth right now, and it definitely kind of like affects my speech, and it kind of affects my mewing to an extent, but I wouldn't really say it's like a problem. It's not like terrible. Your teeth aren't gonna get screwed. Do you have anything to add to that?
No.
I've seen someone trying to bite on a rolled towel cloth okay, that's actually really cool. Bite on a towel to like improve their bite. That's really interesting. I've never even like thought about that. I guess that makes sense, like improve like the bite force and kind of like get your teeth to like go where they're supposed to. That's actually not a bad idea. Interesting stuff. Correct. At 80, you live long enough, so you should prepare to die. Facts. For the more people. TBH, I think Pizzo is raising the success rate, but I think this 100% success rate is BS. I don't know for sure, but that's my prediction. I agree. I think Lipkin was kind of padding his stats a little bit just to kind of get people to buy into his course, just to kind of get people to kind of, take him up on it. I think he was holding back information in that conversation he was having with Ron. He kind of came off as a bit, I don't know. I'm just talking shit, but I don't know. I kind of got a weird vibe from him.
Yeah, I think there's gonna. I hope that there's. I mean, I know that what's his face? Oh, what's his name? Dr. Ling or
Ting?
Dr. Lee? No,
Lee.
Dr. Lee,
That's right.
who does the ease, where there's the top suture split through the nose, and then cuts the sutures like behind the maxilla horizontally, and that connects partially to the zygomatic bone. And I think that combined with the piezo is should be a staple at some point. I just think that you get more expansion this way forwards, because it doesn't have to rely on the limiting the limit of the being attached to the zygomatic bone right here. If it's unattached to it, it can swing out a little bit more,
Mm.
and that might give you more space than just a half centimeter.
Just wondering, how much expansion did you do with MSC? My current pallet is 31, so I'm wondering what millimeter number I should target. Right now, I've only done like 6 millimeters, which really isn't a whole lot. But right now, I'm really focused on like preventing asymmetry before I get my new MSC in with the arch support, because I don't want to like fuck anything up. But 31 is definitely very small. I would definitely aim for 40. So I would try maxing out your MSC. Ting needed the FME to expand after his piezo. I think there are some expanders that will outperform MSC. I agree. There's a power expander as well as that has 4 TADs in the pallet and 4 in the sides. God damn, 8 is definitely overkill. I think 6 is honestly enough. 4 is enough for some people, but I agree with you. The FME is just like an MSC on steroids. I don't really see. I mean, it's also smaller. So, but yeah, I think MSC is just like the first generation of skeletal expanders, and within the next 5 to 10 years they will definitely hone in on the effectiveness and recognize how many TADs are definitely needed to effectively expand the roof of your mouth. What is your opinion on not taking medication when you're older so you die younger? What? Okay. 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 The thing is that even Casey Lee can expand so many of his patients with MSC, and he's a smart guy. He knows what he's doing. Yeah, I agree. Like I said earlier, referring to your question. What natural diet changes to improve teeth and bone density? I guess high in calcium, tough foods, tough bread, tough meat. Just chew your food, actively chew your food, chew on both sides, swallow with your tongue and your tongue only. Make sure when you're drinking water, you're swallowing with your tongue only. If you chew gum, try palate spreading with your tongue. I think all of these things will help stimulate the face and stimulate the bone. Whether I don't really think it's a black or white thing of if alveolar bone can be stimulated or not through mewing or tough chewing, but I definitely think it does help. Please Google her stats. Courtney Chow is planning my jaw surgery. Please Google her stats. No. Casey Lee has tons of hard to expand cases though. Adults like 30 to 40. Yeah, I don't know. I think like I was saying, like FME and all that stuff, the more TADs, the more effective the expander, I guess, and the more effective placement of the piezo. Like what I noticed when Dr. Zabad did mine, he like did it like off center, like the piezo he did off centered, and I thought he was like crazy for it, but it turned out to work. And he kind of like knew that one side of my face was expanded more than the other. So instead of just doing the piezo right along the suture, I think he split or he cut off center just slightly in a zigzag instead of like in a straight line. He did like a zigzag. So I think it comes down to like how good you are and how experienced you are. What is piezo? Google gives me nothing. Piezotome. There's a video on JawHacks. I can actually scroll to it and show you exactly what I'm talking about. MSC Piezo explained. He basically goes in depth about what it is and how it's used and what it looks like and shit. So if you want to watch that shit, go watch it. Shukai would just say blah blah blah. Piezos, blah blah blah. Does Ethan have a YouTube channel or Discord?
I don't. I mean, I do have a Discord, but I don't have it like a server. At least that's used by anybody. But I might have one in the future. We'll see. If you want to, yeah, join the join the Discord that's posted. That's pinned up here,
Oh,
and I'll be in there if you want to get in touch with me. Anybody?
shout out to Discord, man. But yeah, I think you should make a YouTube channel. That'd be awesome. You could like collab for real. I know we talked about that before, but
That'd be cool.
okay. Does correct tongue posture affect over time these bones, the zygoramus, and other bones in the face after 16? I think there's a gray area between like 16, 21, 22 where, excuse me, you can,
Yeah,
you know,
it
but
depends a lot. But
it really does depend. There's a lot of
because
factors.
if you haven't had the estradiol peak to close your growth plates, you can absolutely still have a growth, but just it happens at different ages for everybody. But
Okay, that's just about for me. I'm sitting on the fence and to expand. I'm not so confident as a 30-year-old who's done MMA. I will expand with MSE. I think you will. So I'm going to see for you guys to do it first. That's hard because your bone density is actually the highest when you're in your 30s, like early 30s, right?
yeah, I mean,
So,
yeah.
I
Late
mean,
20s, 30s, 40s, yeah. Well, not 40s. 40s it gets a little lower, but still pretty hard.
if you don't have your wisdom teeth, can you get implants? Yes.
I
But
mean,
you
why
need
would
to
you?
expand.
No, but you wouldn't want to add extra teeth if you don't have them to begin with.
That's
That
true.
wouldn't make sense.
Unless
Like,
they were
I don't know why
pulled.
you'd want to. Yeah, but yeah, if they were pulled, maybe. Like I had that thought a while ago, but if you physically were not born with them, like don't get implants. That'd be dumb, I think.
Do you guys know any MSD providers in South Florida? I know there's one on like West South Florida, but I called them up and asked them, and they were like, "Oh, we're not doing that till next year." And I was like, "Okay." So the only I guess MSD provider in Florida, I guess, would be in Jacksonville, and that's my orthodontist doctor, Zabad Nawaz. So he's pretty cool. Check him out for sure. Look him up. Schedule a consult. What causes a jawline like Timothy Chalamet? I think somebody mentioned that in a comment. Chalamet. He just has somebody said he had like a recessed jaw, but I think he just has God genetics and he was breastfed and just strong jawline, like you can get that. Best type of jawline in my opinion. I agree. He has very strong zygomatic bones. His maxilla is kind of like back, so it amplifies like his mandible and the effect of the mid face and his zygomatic and his jaw. So I don't think he's had any extractions either. Y'all are dope, man. Thanks for the shirt, man. I appreciate you, Saeed. Honestly, yeah. I hate to be this person, but if y'all wanna, donate, shout out to the stream for real. A little dollar or two wouldn't hurt. So we really appreciate you guys being here and staying in tune. Like we've averaged like 20 people this entire stream, so we really, really appreciate y'all staying here and talking to us. We've been planning this for a while, so shout out Ron.
Yeah, well, we should do another one for sure.
Oh God. Honestly, like every weekend, bro. If you're down like next Saturday, that would be lit, honestly. But the only way we could do that is with y'all's support. So shout out y'all and thank you guys for being here. Join the Discord if y'all haven't. And hell yeah, thank you guys.
Okay, yeah, this guy. Okay, so this person is the one who's asking about expanding at 17, right?
Wait.
Chez, 16.
Where's he at?
Chez.
Oh, the Chez guy. Yeah.
So, I mean, you're still growing taller. I'm assuming that you're 16. This person, Chez. Let me know, but it depends how much you're still growing. Because like if you're in the middle of a growth spurt, that is going to be different than if you're right at the end, because that's right when the sutures start to close and when your estrogen starts to go up. But if you are that young, then you definitely have, and you're still growing, you definitely have some leeway. I would personally, this not medical advice, but I really, if I was your age, I might look into AIs, aromatase inhibitors, and be extremely careful if you experiment with that. It's not something to fuck around with, but fuck around with lightly. But you might have a chance to keep that window a little bit open a little bit longer.
Leon, thank you very much for the $10 donation, bro. Shout out Leon. He's been here this entire time, so we really appreciate that. Leon the GOAT. Leon Kennedy the GOAT. Yes, sir. Thank you very much, man. Can I get into a Discord with you guys? Yeah, the Discord is this.
Yeah, look at the top of the pinned.
Oh, is it pinned?
It's starred, yeah. It says it's
okay,
starred. Well, maybe it started in the StreamYard, but I don't know if it is on YouTube.
Oh, shit. Yo, again, Leon, we really appreciate it. Thank you very much. That means a lot. I got negative money. Me too, bro. Some of these double jaw surgeons, which are oriented to downwards in the planning, uncanny as shit. Yeah, dead ass. I don't really understand that. It doesn't really make sense.
Well, to me, I think they're doing that because like you can only cut the maxilla at a certain angle. You know what I mean? And it's going to be pretty hard to upwardly swing that, because then the back of it, you're just going to have this big gap where the bone isn't touching. You know, so you need to somewhat keep it in this plane that the zygomatic bones are already in. That's
right.
Part of the issue with this double jaw surgery. But yeah.
I grew 1 inch in the past, bro. If I were you, bro, I would be actively mewing. I would be strictly nasal breathing, and I would be chewing tough foods.
Yeah,
because I don't, bro. You are in the prime,
dude. Yeah, I would do so many things, but that's a lot. I mean, that's a lot in 2 months.
Yeah, that's insane.
I really might look into AIs as well as at the very least, like really get as many estrogenic compounds out of your diet and your environment as you can, because that's what the feedback mechanism is for. That's how that mechanism works. So if you don't want to go the AI route, definitely just get your. I mean, I don't know if this guy has breathing issues or anything, but really get like it. Don't fuck around with anything. Like, don't socialize. Don't fucking go to sleep at a normal hour. Like you'll be very, like, you can always do that later. Just fucking
and do push-ups if
yes, as much as you can.
Do
sure.
like hella push-ups, because I'm about to do push-ups right now. So if y'all are beasts and y'all ain't pussy, do some push-ups.
Yeah, definitely do some. I mean, do sauna. Sauna is definitely good. Occasionally, for long periods, like once, twice a week. That
Get your diet right.
Yeah.
I've been chewing meat, carrots, almonds so far. Good, bro. Definitely. Yeah, definitely mew and definitely like nose breathe. I think that honest and make sure you're outside. Make sure you're like really working out. Like, don't skip working out. Like, I think at that age,
yeah, it
really builds like the frame for your body.
Also, definitely if you can't get sun exposure, definitely do artificial light. It makes a big difference. It's not just vitamin D3 at all.
Bro, if you're 17 and you're not like 100% like omega-3s, like lemons, like fruit, antioxidants, get vitamin C, like make sure you're working out, bro. Like, this is literally like the foundation of your body for the rest of your life. So work out, don't drink anything else but water. You don't need any caffeine at 17. Your energy's like off the wall. So like, just be honest. I don't know how to join the Discord. Bro, I don't know what to say. I think it's weird. You have to like copy and paste it or something, but just like look up a YouTube video. John, okay, fine. For the last couple of minutes of the stream, we'll look up some faces and then
Ches is asking about the estrogen. If you want to, if I would love to talk about this with you guys, so definitely add me and join that group, and then we can message about it. But definitely in terms of non-pharmaceutical approaches, to some extent there are estrogenic compounds in certain plant foods. But I think the bigger impact is unfiltered water and drinking out of plastic and cooking in coated cookware as well.
Damn, she fine as fuck.
I
I don't even. Is this like a soccer player or something? Yeah. I don't even know who this is. I think he is a soccer player. Yep. Cruyff. Strong ass jawline, goddamn it. Damn. Strong ass man away. I don't know. It looks like his cheekbones are a little bit flat. And his maxilla is a bit recessed, but I mean you can kind of tell by these creases here. Typically when people have like these creases along their face, they're either like they have really poor skin or their maxilla is recessed. I mean, he has a pretty strong jaw here. Cheekbones are kind of flat, but strong brow bones and strong nose. Did he have like extractions or something? I can't really tell. Yeah, it looks like he did. The creases here. And under eye support is almost non-existent. He looks young here too, like late 20s maybe. Damn. All right. Who else? Chico Lachowski. This man. He looks like he has a pretty strong face, I guess. Beautiful posture. Just kidding. Is he like a model or something, bro? It's like Johnny Depp, my guy. All right. I feel gay looking at this, so I'm not doing this. Am I homophobic? No. Don't say that. People say he's recessed. Chico? Oh, okay. People say he's recessed. I'm talking shit, guys. I'm sorry. I can't really... Okay, let's see. Yeah, he's recessed. This picture tells me everything. This is kind of how my face, like specifically the cheekbones, look after like MSE and after I had extractions, specifically post orthodontic treatment. You can kind of tell his maxilla is recessed because his mandible is very large and it kind of goes into his neck. And that's typically a sign of a recessed maxilla because, like I mentioned before, if the maxilla is recessed, the mandible has to follow to meet where the top teeth are. So, hell yeah, he's definitely recessed. You can tell in here and you can tell in here. Because if not, this would be a bit more prominent. He has very low body fat, so his jaw really shouldn't be like that. And it seems like, yeah, I think he's recessed. Maybe slightly, not a lot, but definitely slightly. Messy.
So one sec. These go to the I can't add. Go to the chat and let's see. MWM. Are you asking for my username? Mine. I think mine is just ET. Honestly.
I think you might have to like copy and paste it.
Oh, it's like a bunch of.
Yeah. If he's recessed, that's not good for me.
Yeah.
I would say like the majority of people are recessed or at least underdeveloped.
Yeah. How do I? Is it just like? Sorry.
What the fuck? This man Chez is literally living like Khabib in this bitch. I'm at home most of the time. I live in the woods, but I'm trying to get more sun often, and I've been drinking 80 ounces of charcoal filtered water. Damn. Goddamn.
Here, I'm gonna send. I think is this how you do it with the number after? I'm gonna send that to you.
Yeah. In the chat. Okay, let me copy this.
But you'll probably just see me in the in there. But
yeah, Discord is like really weird when it comes. That is Ethan's Discord for Rosewater. Right here. I'm gonna push back a little here. I don't think he's recessed. I think he's had he has optimal aesthetics, and if you try to do a DJS, some of the surgeons like Alvaro is going to use a downward standing speed to justify. Yeah, I don't think he's completely recessed, but I think he might have had some sort of like
Well,
retraction.
I do think that people like you can have signs, you can have small signs of recession and collapse, but without like completely changing your entire
Absolutely,
structure. Like it can be like, oh,
absolutely.
there's a little bit of sinking there, right in behind the eye. Like it's not like that. Everyone needs jaw surgery because they have slight
Yeah,
recession, but it's still there.
yeah. It's not. Yeah, exactly. That's exactly. Johnny Greenwood, Radiohead. Wow. I'm sorry. What was it? Wait,
Oh,
what?
he's so good.
This
I
guy?
love him.
That's Doctor Strange, right?
No. Greenwood.
Oh shit.
Well, he's good too, but
He must have had some sort of extractions because his mandible is
well,
extremely small.
no, I mean, maybe I have no idea, but I think it's more likely that it was drug use.
Oh yeah, and he was
Because that's a very
bleeding
common
lot.
with drug use. And that is like drug use is it proves that you to some extent like the environment in your mouth it has a is able to change the structure of your bone and your maxilla. Like you're gonna lose teeth, you're gonna lose bone around the teeth, you're gonna lose a little bit of maxillary bone.
What would be like agreed, especially if you're like completely your muscles are so relaxed, like you're not even like chewing tough food, because I can imagine you're probably not eating a lot. I can imagine when you're unconscious, your mouth breathing. Um, you know.
Or if you're on like stimulants and you're clenching a
Yeah.
lot, like a lot of people with like that meth sort of chin look, they're like smoking and they're just like grinding their teeth and they have no jaw.
Okay, I guess.
Yeah, Chakra was saying the non-stick. Absolutely yes. Chakra.
Could cause
all sorts of things, but
oh yeah,
just I do not fuck with them at all.
I guess perfect growth. Honestly, Charles Oliver. I mean, he kind of has like, if you look here, I don't know. I'd say his mandible's kind of back, but he has very strong, prominent forward cheekbones and brow bones. He has one of the strongest chins in MMA. So, but like
Shukai, I'm definitely in a very similar situation to you.
For what is he talking about?
For his comment about it's hard because I have really bad sleep apnea, so I'm basically suffering while I try to figure out how all this works. Yeah. I'm just going back in
here. Man. Perfection is a bit subjective. I agree. I agree, 100%. His face is very strong. Yes. Margot Robbie is a close example. 1,000%. So, what are foods to avoid? Very soft foods that don't require you to chew for a long period of time. Foods that are easy to swallow. You want the food to kind of, it takes you a while to chew, like medium well steaks, chicken, any sort of nuts. Tough bread is another one. I think that's underestimated, but there's a lot of food like like beans, applesauce. Yeah,
I'm personally not a fan of grains, but yeah, definitely soft stuff. I mean, I don't know, especially at his age. I don't know if you need to go super hard, but I think the person was mentioning the towel thing earlier
Right.
with the bite, and to some extent you can mimic that if you're eating meat that is attached to a whole piece and you have to pull it and tear it. I mean, not everyone's going to want to do that, but you can definitely mimic that if you want with the towel.
I have allergies. Johnny Depp, I think he's kind of recessed. I think he actually had extractions. Oh man, the meth chin. Bro's like, I seen that.
Yep.
Wow.
Same.
I wake up literally 20 to 50 times a night.
Yeah.
Holy shit.
Dude, we need to do another episode about like management of this stuff, because a lot of these people have similar issues to me. Because you definitely can be Shukai. You can definitely do some things where that you can intervene and just before you're getting the treatment done, in ways that will really you're still going to have obviously the sleep apnea, but just the amount that it wakes you up and stresses you out, and then you have to go back to sleep and etc. So you'll just wake up, but you're not going to be so stressed out and remember it every single time. Because even just the stress of knowing that you have the sleep apnea can be worse sometimes than actually having it. Because you like kind of know how bad it is for you, and then you're just like anxious about how bad it is. So it's not really helpful.
Wow. Yeah, this shit is definitely not something to play around with.
I need to get here. Let me send you this.
Somebody in the Discord dropped a really cool journal regarding neurotoxicity and sleep apnea, and I wish I could show it. I just don't know where it's at. It's way up there.
In the Discord or in the comments?
In the Discord, it's gone.
Yeah,
it's like probably a couple months ago.
I mean, I have a lot of different links I could put. I'm trying to find this one. Oh, here. So this is here. I'll send this to you and play this. As a 3-year-old? Damn.
Yeah.
Yeah. So this is what's going on when you're sleeping and when you're breathing. And this is part of why it's so destructive to the brain during sleep apnea. So you have the glial cells basically are these support cells that they're like support cells for neurons essentially. And basically the people were mentioning in terms of the tight neck or hyoid bone where the lymphatic drainage was occurring, and that contributed to the acne, and the craniofacial dystrophy. A similar thing is happening, but because it's called the glymphatic system, but it's similar to the lymphatic system in the rest of the body, in that it doesn't have really there's no muscle or organ that pumps around the lymph like there is with the heart for the blood. So you end up having these glial cells that need to drain these metabolites and proteins from the brain, but they can't actually do it. So they end up. So obviously the amplified version is just trying to like visualize it for you, but on a very, very micro level, there's a squeeze and there's a positive pressure, negative pressure, positive pressure, negative pressure, and it pulls the stuff out of the tissue and into that system. And so when you're not getting into sleep, especially into REM sleep, but in general, if your sleep cycle is not normal, your brain is not going to be able to clear out those metabolites from the brain, because like when you're in that state where you're actually having the apnea, the lungs are actually responsible for that movement in the brainstem and the spinal cord.
That's really interesting. I had no idea that was even a thing.
Yeah, so when you stop breathing, like it stops. Plus, it's hypoxic, but it's a big issue. But when the thing is, when you have those, when in Alzheimer's or dementia, in so many different degenerative diseases, like you have these accumulation. People, obviously, some people will be familiar with beta amyloid plaques, but in Alzheimer's, but that and these tau tangle proteins are associated with Alzheimer's. But I mean, dementia and macular degeneration, a lot of these, there's always going to be like a specific mechanism for each person. But in general, it essentially just accumulates, whether it's beta amyloids or tau tangles or something called lipofuscins, that gets kind of trapped in cells and neurons. Your brain just gets really bad at clearing them out over time. So it becomes hypoxic. It sends more and more sugar. It becomes to the cells. It becomes more insulin resistant, and the cells just essentially stop working eventually when you get older. And that's exactly why this part of why. So we talked about the acetylcholine system a lot, but when you're antagonizing the acetylcholine system with like antihistamines, like Benadryl that people use, or even just regular sleeping drugs, they're not, like sedatives. They're all associated with the accumulation of the lipofuscins, right? As well as just all sorts of metabolites and metals and things that accumulate in tissues that, like most other tissues, have blood flow, so they can, not that the brain doesn't have blood flow, but it doesn't have the same clearance system. Anyway, so one of the things that I've been talking about and that I personally am doing is doing a lot of cholinergic supplementation and augmentation. So like when basically some of you might be familiar with lucid dreaming and that sort of community. And a lot of people in that community, partially due to some research, but also just through experimentation, find that things that inhibit the breakdown of acetylcholine, as well as precursors to acetylcholine and releasers of acetylcholine, or acetylcholine receptor agonists in general, they're very involved in shifting the non-REM to REM ratio in each sleep cycle. So a lot of these people will fall asleep with a nicotine pouch in, or they'll take we could talk about it later, but there's a bunch of different things that you can do to increase the level of acetylcholine acutely in the brain and in the whole body. But so you end up with, some people were mentioning that they had extremely low REM sleep, and I'm also in that category. But people notice with the lucid dreaming that when you take these acetylcholine enhancers or precursors, they increase the amount of REM sleep you get by a large margin. Plus, in some cases, people end up being lucid dreaming for it and being awake for it. And there's some sort of association where, like, in REM sleep, your brain is disconnected from all your body movements. But this is really interesting in this context, because the only muscles that your body really controls and moves a lot during REM sleep is your facial muscles and your jaw.
Wow.
And so it's clenching. It's so when you're going through REM sleep, specifically, your brain is trying to nose breathe, obviously, but during the sleep, it actually disrupts the cycle of REM sleep because it disrupts your breathing on a, it has to get out of REM sleep to open your jaw, essentially. And that's part of why people just get tons of deep sleep, but then no REM sleep, and their memory gets worse. Their macular degeneration is very common. One of my eyes has gotten worse since this has been going on for a while, and since I've been doing the cholinergic supplementation, my vision is absolutely better. Like, it's definitely sharper. It feels way sharper. It was mainly in this eye because I've had injuries on this side, but yeah, I'm playing around with this personally and trying to both augment my existing sleep, but also get rid of some of the effects of the hypoxia that's been happening. But one of the it's called centrophenoxine, but it essentially is one of the only. So the lipofusions are essentially just associated with certain neurodegenerative diseases, mainly macular degeneration, but there's a bunch of other ones, and they happen in everybody. But they're essentially like, here, let me send you this real quick. They're essentially these fat residues that are covered, that are intermixed with like heavy metals and a bunch of different things. I'll just give you the Wikipedia because it's the easiest, but just the photo. Okay. There we go. Yeah, if you could put that.
Did you send it on Discord or private chat?
I think private.
I don't see it.
Really?
I see the YouTube
Yes.
link.
Oh,
there it is. There it is. Bring Sally up. Bring Sally down. What the fuck?
Yeah, so zoom in on that. Yeah. So it's in every single neuron, right? This is part of like, every tissue every neuron is going to have certain things that it needs to, and cell has certain tissue, certain metabolites and metals and things that it needs in certain amounts in the cell, right? And so as you age and as you go through more cellular stress and have, cellular aging, your body gets worse at clearing things like lipofusions, as well as the what are they called? The tau tangles and the beta amyloids, right? There's plenty of others, but if you look at this, right? So, so the oxidation. I'll just read this, but the oxidation of the unsaturated fatty acids, right? Symptomatic of membrane damage, and so these metabolites get stuck in the cell, and then they get tangled up with, metals like mercury and aluminum, etc. And I personally, if you look at this is somewhat unrelated. I guess it is related. So if you look at this, it's partially the product of the oxidation of unsaturated fats, right? And people are asking about the dietary changes. Definitely, if you can get out as many seed oils and unsaturated fats, at least they're mainly from seed oils where they're an issue, that is going to have a big impact on this process. But it's also, extremely, it's going to help the inflammation a lot throughout the back of your nose. I personally get a lot of inflammation when I eat like a bunch of processed food or with a bunch of seed oils or bread or Yeah. And I would, it's really, I've noticed a big difference. I mean, they're getting those out, but the oxidation of the unsaturated fats are really connected to a lot of different health issues. And the thing about the unsaturated fats and seed oils, anything that's like in the store that's in a bottle, one, it's probably in plastic, but two, it's to go through the entire process, you have to heat it up and extract it with different chemicals multiple times. And during that process, you absolutely are oxidizing it. And so any of those vegetable oils are completely oxidized, and they're just not anything that you would ever eat evolutionarily. You're not really eating. You have to. I think it's like something like 100 ears of corn that you have to use to get a tablespoon or two of the oil. Like, it's a very inconsistent amount of these plant unsaturated fats, and they're very easy to get out. So, Ches, I would definitely recommend that to you. But I think anybody with this issue, I've noticed a big difference with the. It's probably on this page, honestly, and somewhere in there, but the centrophenoxine is the only external supplement that has had any sort of. It's not that well studied, but it's the only one that has been studied enough at all to be able to help your brain clear the lipofuscins from the neurons. And coincidentally, it just so happens to be acetylcholine precursor, right? It's like a choline with a different little group attached to it. So this whole cholinergic, we'll do another video on this, but like this whole cholinergic system is very interesting and very very connected to the sleep apnea and the cognitive decline during sleep apnea.
Wow.
And I think because the only real like there's two different drugs that are shown to slow down the symptom acceleration of Alzheimer's, right? But there's no cure at all or anything that reverses. But one of those two is acetylcholinesterase inhibitor, making it more available in the neuron, right? And it's just kind of a no-brainer to go through that route, to me. Let's see. Yeah, wow. And I guess just because like the reason I think there's like it's so the thing about the Alzheimer's research is that it's always being done in patients that are caught at a very late in the stages of that disease. And so since most of us are way, way younger than that, we're going to be way better at clearing out the effects, clearing out the metabolites that are inhibited when you have this lack of sleep and REM sleep. Like that's part of why the sleep apnea can happen for so long undiagnosed in like 90% of people, because you can adapt to it for a while, but you don't really see the changes that are happening. So since we're like catching it early enough, and even if you don't have sleep apnea at all, like these supplements are incredibly helpful for a lot of people, and they're very well tolerated. They're really not anything insane, or I don't like to. I mean, I mess around with a lot of different like chemistry and just doses and substances, and it's just like I'm just trying to get as much out of my health as I can, and I'm not,
absolutely.
I don't want to. Like I could be on like a bunch of Adderall every day to have like a lot of to like force myself to be in that state, but it's not as sustainable as I think as some of these other approaches.
Wow.
But I can
No, yeah,
I
that's
can send you here. Let me send you one of these.
Please do. I do have to get going soon, but
Yeah. How long you got?
like 2 more minutes.
All right.
Before we hit 5.
Yeah.
Bryce Haley up. Where's it down?
Oh, I don't know which one to send. Honestly, there's too many. But, yeah. I don't know. Anything that you want to talk about or?
Nah, man. I feel like we've hit everything we kind of needed to for today, but I just want to thank everyone for being in the chat today. For I really appreciate everyone contributing knowledge and asking questions and joining the Discord. And thank you, Leon. I think his name was, for the donation. And I really wish the all of these comments would stay on the video, but I sadly don't think they will, which is sad. But I really hope
they won't stay in the YouTube.
Nah, sadly. I don't think so. We'll see. But the last one I did, someone let me 200,000. Wow. But anyways, it was good being with y'all. I really enjoyed this. And thank you, Will. Thank you, Moses. Thank you, Philosophy. Thank you, Will. Thank you, everyone that was in here. Shukai. All y'all, for real. I really appreciate everyone being here and supporting us, and hopefully we can kind of make this an ongoing thing. And yeah, man. Till next week, huh?
Yep. All right.
See you.
See ya. Have a good one.
Bye.